गुड इवनिंग गाइस, होप यू ऑल आर फाइन. गुड इवनिंग एवरीवन बेटा. यस, अभी ठीक करके दे देंगे, टेंशन मत लीजिए. यस, आई होप ऑल ऑफ यू गाइस आर हियर. गुड इवनिंग एवरीवन बेटा. So just waiting for everyone to just join up. Yes, so all of you guys are here beta. Thank you all for joining me again live. I was expecting that when this day will come so that we can meet one more time and we can discuss the 25 most important clinical type questions that might be asked from biochemistry as well beta. So just allowing me one more time please. Allow me please one more time. जादू जादू तो कोशिश कर रहे हैं, बट लेट अस सी दैट हाउ फार वी कैन गो फॉर दिस जादू. यस, पूरा एफएमजी का पेपर बना देंगे, चलो ठीक है, वो भी कर देंगे. एंड यस, ऑल ऑफ यू आर ज्वाइनिंग बेटा. जस्ट डू अलाउ मी सम 1 minute मैक्सिमम टाइम. थैंक यू बेटा, थैंक यू. नहीं बेटा, आप लोग ग्रेट हो, यू गाइज आर ग्रेट दैट यू हैव बीन पुटिंग द best possible efforts for the last couple of months. Really, hats off you from the core of my heart, beta. Really, big thanks and big hats off you to every one of you, beta. That the amount of perseverance, amount of dedication that you guys have been putting forward for the last 4-5 months, definitely, God will bless you with the success, beta. You will be able to achieve your goal without any doubt. So, without wasting much time, let us try to move to the questions that we are anticipating in the exam beta. So let us try to begin with the questions for the 12th January exam. Now the first MCQ beta, first MCQ. Let us try to focus on this and try to focus on this. Yes, चलो, मुझे देख के लग रहा है ना सब हो जाएगा, बिल्कुल हो जाएगा बेटा. यू गाइज हैव पुट फॉरवर्ड योर बेस्ट पॉसिबल एफर्ट्स एंड यू ऑल विल पास माय डियर फ्रेंड्स. 12 जनवरी को हम लोग एकदम फाड़ के आएंगे. टू बी वेरी ऑनेस्ट विथ यू माय डियर फ्रेंड्स, 12th January इज ऑल्सो एक्चुअली ए वेरी blissful day, great day, because 12th January is actually also the birth date of Swami Vivekananda ji. So definitely, his blessings also will add up with all our blessings. Entire team of mist is praying all of for you, and definitely all of you will be coming up with the colors better. Yes, questions को target करते हैं. Yes, already the answers has started pouring in. Okay, question को एक बार देख लो बेटा. Just see the question and then we will come up with the answers. Yes, this sort of questions are highly anticipated in our exam beta. Highly anticipated. Yes, highly anticipated. All of you are right beta. All of you are right. क्या बात है? All of you are right. Yes, all of you are right beta. Let us see the question. Yes, all of you are thinking in the right line. It is going to be a. Yes, all of you are right. B1, my dear friends. Okay, question. How do approach this sort of questions beta? How do we particularly approach this sort of questions, my dear friends? Without any doubt, just try to see over here. They had been seeing that the question language has begun with the word generalized weakness. During our discussion at missed classes, we have discussed multiple time, my dear friends, that basically in the classes we have seen multiple time beta that just a moment, yeah, that there is a chance, my dear friends, yes, that there is a chance of this sort of questions asking with the word of generalized weakness. The patient also presents with lethargy beta. The patient also presents with lethargy and result difficulty in performing heavy exercise. Remember that he also complains that suddenly at night he has been waking up with gasping for air, and on the nights of consuming alcohol. Basically, all of us know vitamin B1 deficiency exacerbates alcohol, and one of the most common cause of vitamin deficiency in India is also alcohol consumption beta, right? Most common is the alcohol consumption, and this sort of patients of B1 deficiency who has been suffering from beriberi, this is the diagnosis beta. What is the diagnosis of this condition? Yes, it is due to B1 deficiency, but the diagnosis wise, please remember, it is going to be a case of beriberi beta, and basically they will be presenting with the generalized weakness. His blood examinations was unremarkable. The BP is little bit on the higher side. Heart rate is also quite elevated beta. Heart rate is also quite elevated in this particular patient beta. Tachycardia, and please remember, there is numbness. There is no numbness. Oh, there is no tingling sensation in this question beta G. There is no tingling sensation. No numbness means in this sort of beriberi there is no numbness in his bilateral arms and legs. But my dear friends, over here we can all easily understand that he has got some swollen legs beta. This is a point that we need to focus over in this question. This is a bilateral swollen legs. So this is, my dear friends, it is a case of wet beriberi, not dry beriberi beta. It is a case of wet beriberi. Bilateral swollen legs that we are trying to understand over here beta, this is due to pedal edema. Let me write it over here for each and every one of you. Please try to pay attention over here. This is a type of pedal edema. Please try to understand, my dear friend. This is a type of pedal edema that we are seeing in the patients of wet beriberi. Pedal edema is quite common over here, and this pedal edema, my dear friends, the cause of this is actually high output cardiac failure. This is actually high output cardiac failure. Heart failure is also quite common in the patients of wet beriberi beta, and due to this high output cardiac failure, heart failure, the heart is not able to pump much of the blood. That's why the heart rate is increasing to compensate for that. The cause of tachycardia in these patients is due to the compensation of this high output cardiac failure. So this is a case of pedal edema. Pedal edema beta, and this is a diagnosis, my dear friends. All of you are thinking in the right line beta. It is a case of wet beriberi. This is a case of wet beriberi. Remember, in wet beriberi patients, we do not see much of tingling sensation. There is pedal edema, but in patients of wet beriberi, basically there is no peripheral neuritis. There is no peripheral neuritis. There is no peripheral neuritis in these patients beta. यहाँ पर कोई भी peripheral neuritis नहीं होता है. That's the reason there is no tingling sensations or pins and needles. There is no tingling sensation or pins and needle in these patients beta. This is an important point. Try to understand. Every time in the question of B1 deficiency, they might not use this word of tingling sensation. ऐसा जरूरी नहीं है कि हर B1 deficiency क्वेश्चन में tingling word मेंशन होगा. जैसे आप लोग देख रहे हो, in this particular question there is no numbness. No numbness, my dear friends, is basically pointing toward there is no tingling, but these patients are presenting with pedal edema. On top of that, patient is also consuming occasional alcoholism. So that's why high output cardiac failure are expected in these questions. And please try to understand, in this sort of question, my dear friend, diagnosis will be wet beriberi. All of you are right beta. It is going to be a case of B1 deficiency. Dry beriberi, no edema. Dry beriberi, no edema, but peripheral neuritis. Wet beriberi, edema but no peripheral neuritis. Dry beriberi में no edema but peripheral neuritis. Wet beriberi, there is edema but no peripheral neuritis. This is a point that we have to remember better. No paresthesia will be seen. However, all of us know tingling sensation, the most common vitamin associated with this is B12 deficiency followed by B1 deficiency, and in this case the history is also supportive of this alcohol consumption over here. That's why this question will go for B1 deficiency. Coming to the second question, but look at this question, second question. Hope all of you are able to see this clearly. Second question देखते हैं. Second question देखिए. Second question. आराम से टाइम लेके, हड़बड़ी नहीं करना है बेटा, हड़बड़ी नहीं करना है, टाइम लेना है आराम से. No need to rush. We have time. What is this question? Yes, all of you are thinking in the right line. Yes. All of you are right. क्या बात है? All of you are right beta. The answer in this question particularly going to be B12 deficiency. Yes, option D is the right answer. All of you are thinking in the right line. Now, how to approach such question for everyone? Please remember 3-month history of diffuse weakness. Yes, in this question also generalized weakness is mentioned. Along with that, there is tingling of our hands and legs below. Please remember predominantly. Please remember tingling of our hands and legs below the ankle joint predominantly. Please try to understand in these cases हाथों में पैरों में झंझनाहट जैसा महसूस हो रहा है पेशेंट्स को बेटा, and neurologic examination shows there is weakness of our extensor as well as our flexor muscles. Extensor and flexor muscles are actually not able to work properly, particularly in the lower extremities, and sensation of position and the vibration sense is also decreased in all extremities. I told you better, this particular question, this sort of points, that vibration position sense, if it is gone, then the answer will be going for B12 deficiency. B12 deficiency. Yes, all of you are also right with the diagnosis, my dear friends. Kya baat hai, kya baat hai. All of you are thinking that this is the case of SCD, and all of you are right. All of you are right. It is actually a case of SCD, subacute combined degeneration. Please remember, beta, all of you are right. This is a case of subacute combined degeneration. SACD, many people might call it as SACD or SCD, subacute combined degeneration, my dear friends. And in this sort of patients, my dear friends, there is a damage to both sensory and the motor tracts together. Try to remember better. In this sort of questions, my dear friends, combined word, because in these patients, why it is combined? Because sensory plus motor आर डैमेज टुगेदर, एक ही साथ, एक ही पेशेंट में एक ही वक्त पर सेंसरी ट्रैक्ट्स एंड द मोटर ट्रैक्ट्स आर टेकिंग एन हिट. बिकॉज in this sort of patient, try to understand, B12 deficiency will cause decreased regeneration of our SAM uncle. हम लोगों ने पढ़ा था, there was an uncle who was a very very important uncle for all of our life, that is known as SAM uncle. बिना SAM uncle हम लोग जिंदा नहीं रह पाएंगे. Please try to remember this point, beta. And in patients of B12 deficiency, there is a decreased chance of regeneration of the SAM. And SAM is very much important for the methylation reactions of our myelin protein as well. SAM is important for the methylation of myelin, and as SAM is getting decreased over here, please remember यहाँ पर methylation of myelin sheath will not be able to be possible. Methylation of myelin will not be possible. That's the reason there is no methylation of myelin possible, my dear friends, in these patients, and there is no methylation of myelin, so myelin sheath will not be able to mature properly, and that's the reason wherever myelin sheath is there, it will be having a tendency to get damaged, and myelin sheath is present in both sensory and motor tract. So this is not due to like upper motor neuron and lower motor neuron lesion. Here the cut is at what level, that is not important. There is throughout, पूरा का पूरा nerve fiber can get damaged over here, and this is due to failure of methylation of myelin basic protein. Basically, what is the amino acid present in the myelin which was supposed to get methylated? Please remember, it is the failure of methylation of arginine. Please remember, it is arginine. Arginine methylation is not going to take place. Methylation of myelins, which amino acid? Arginine. By chance, if they ask you in detail question, beta, please remember, all of you have discussed, there was a mnemonic called as Mr. C3P3 RND, multiple time type, and Mr. C3P3 RND में M, one of them was actually myelin, and myelin is a protein, and this proteins, which amino acid reads the methyl group? It is arginine. Arginine methylation is not taking place in the absence of SAM. That's the reason the nerve fibers are getting a damage. Yes, arginine. By chance, if they ask you this amino acid name, it is a failure of methylation of arginine amino acid of myelin sheath. That's why there is a major damage. And please remember, in this sort of question, the particular type of paresthesia that we try to see, we also called as glove and stalk. Yes, glove and stalk paresthesia. In this patient, the history in the first line, it is telling you regarding glove stalk type of paresthesia. बेटा, ये जो word यहाँ पर दिखा गया है, please remember, tingling of our hands and legs below the ankle joint. Below the ankle joint is where we are wearing socks. Glove and stockings. Glove on the hands. Try to understand, this is a glove stalk type of paresthesia. Glove stalk type of paresthesia, if it is mentioned in the question, beta, then also you have to choose the answer of B12 deficiency. This is a special type of tingling, more tingling seen in case of patients of subacute combined degeneration. And in these patients, I also told you to remember, two signs will be positive, beta. One of the sign was actually Romberg sign. Romberg will be positive, and the second will be the Babinski sign will be also positive. Babinski also positive in these patients. Yes, glove stalk. By chance, if they try to cook up the stories more and more, that with eyes closed the patient is swaying like this, with eyes closed, the patient is not able to maintain the proper posture, then it will be a Romberg sign, my dear friends. And you don't need my help to teach you what is Babinski sign. You also know you have to take a sharp object and basically stroke the outer portion or the lateral sides of our feet and sole. That's why you will be getting the dorsiflexion and the fanning. All those things all of you already know. Try to understand this. Yes, hope all of you are crystal clear on this point. Try to remember this. Glove and stock type of paresthesia, subacute combined degeneration is the case, B12 deficiency is the cause of this. That's why happily marking with all of your permission, the answer is going to be D, vitamin B12 deficiency is the right answer for this sort of questions, right? Coming to the next third question, beta third question में आते हैं. Third question को देखते हैं आराम से. Okay, no need to rush, आराम से देखो. Third question, please tell me the answer. थर्ड क्वेश्चन आराम से, टाइम लेना है, हड़बड़ी नहीं करना है बेटा. रीड द क्वेश्चन. बायोकेमिस्ट्री में रीड द क्वेश्चन प्रॉपरली एंड देन आंसर. हड़बड़ी नहीं. टेक टाइम एंड आंसर. Try to look at this question beta. What is this question, what it is telling it? So yes, yeah, see, now the answers are coming multiple time. Yes. Some of them are answering B, some of them A, some of them C. A and C. Okay, majority of you are confused between A and C. Okay, what is the question? Read the question. Please remember, a 25-year-old, sometimes patient's history is also important beta. 25 साल का लड़का, 25 साल, not an old guy, young guy. 25-year-old male presents with hypercholesterolemia, and that is definitely increased risk of heart disease. History taking, once it is done properly, it is telling that there is elder brother also had similar funding and died at the same age, almost at the age of 30 years. So as you are seeing brother and the elder brother, that's why many of you might be thinking the answer is going to be familial combined, because in this option C there is familial and combined hyperlipidemia. But my dear friends, please remember, in this question the answer is not C, answer is actually A over here. The correct answer of this question is actually A. Here also there is a word called familial hypercholesterolemia over here beta. Now in these patients, what is the problem? Basically, these patients LDL receptors are actually deficient. There is a congenital deficiency of the LDL receptors, and due to which it is only the LDL level, my dear friends, which is going to shoot up. Other parameters will be okay, normal. If you go for lipid profile estimation of these patients, our triglycerides, VLDL, all those things will be normal. Routine, it is unremarkable, except one, that is LDL, it is on the higher side. All of you know LDL normal level should be below 100. In this case, it is shooting up to 230 mg, LDL receptor. So this primary familial hypercholesterolemia, what is this disorder? In these patients, try to understand. They have also given you a history that in this, that image is given. Please try to understand. Let me zoom in, and in this image you are seeing that here there is yellowish deposition of this. You are able to see the bony prominences of our knuckles are actually having. This is a type of xanthoma beta. This is what type of xanthoma beta? Knuckle xanthoma. Yes, all of you are right. This image that we are seeing over here beta, this is an image of knuckle xanthoma. ये knuckle xanthoma होता है बेटा. This is an image of knuckle xanthoma. All of you are right. ये knuckle xanthoma है on the extensor surfaces of our hands. And this sort of knuckle xanthomas are also quite commonly seen in the primary familial hypercholesterolemia. It can be also over the tendo-Achilles tendon. We have studied tendon xanthoma, TAT xanthoma, tendo-Achilles tendon xanthomas, larger tendons, and on the tendons on the extensor surface of our hands and feet, it is on this. This is an important hint in this question. However, if it is familial combined hyperlipidemia, which is actually type 3 over there, it is on this side beta. Palmar xanthomas will be made prominent in case of the C option over here. In this case, the hint is knuckle xanthoma, my dear friends. Knuckle xanthoma, primary familial hypercholesterolemia, right? Important point. Try to remember this. And remember, this is actually the type 2A of our Frederickson-Levy classification. This is known as PFH, primary familial hypercholesterolemia. The cause is due to congenital LDL receptor deficiency. Congenital LDL receptor deficiency बेटा. In patients में LDL receptor नहीं होता है. That's why LDL is not able to be picked up by the peripheral tissues and they will be present in the circulation for longer time, and that's the reason, my dear friends, they will be also having higher chance of LDL deposition throughout the body anywhere, and they can also present with this knuckle type of xanthoma. Usually these patients do not survive beyond the second or third decade, and please remember the inheritance pattern is actually autosomal dominant. Also remember type 2A is the most type of hyperlipoproteinemia that will kill the patient, most fatal. Please remember. No, not in now. No, Aditya, not X-linked beta. It is not X-linked beta ji. Aditya, it is not X-linked. It is, yes, one more time beta. It is not X-linked beta. Please remember, this is autosomal dominant. This is autosomal dominant. Most fatal beta, autosomal dominant. One more time. It is autosomal dominant beta. Autosomal dominant. Please remember, this is an autosomal dominant pattern, and this is the most fatal type. Most common type, unfortunately, is also the most fatal type in case of primary familial hypercholesterolemia. Please remember, very, very important. Autosomal dominant, type 2A, congenital LDL receptor deficiency. In these patients, LDL will be shooting up, as you are seeing in this question that we have mentioned. LDL is up to 230 mg per dl. Please remember, this PFH is actually for two types beta. There are two types. There are two types beta. There are two types over here. Two types. One is called as heterozygous. Another one is called as beta homozygous. Heterozygous, homozygous. In patients of heterozygous, the problem is still somewhat manageable. You can prolong their life, you can increase their lifespan, and this is up to 250 to 300 mg per dl. LDL, my dear friends, it is up to 250 to 300 mg per dl. 250 to 300. Voice problem, now it is okay. Now is it okay? Hello everyone. Yes, now I hope it is okay beta. Try to understand this. LDL 250 to 300 mg per dl. If you are seeing it in this range, it will go for heterozygous type of primary familial hypercholesterolemia. Okay, and if it is type of homozygous, it can go even up to 1000 mg per dl. Please remember, in these patients it can shoot up further. It can go even up to 1000 mg per dl. 1000 mg per dl. One more time beta, there was some voice break. Repeating beta, two types of type 2A. Type 2A can be of further two types. One is called as heterozygous, another one is called as homozygous. In heterozygous, the problem is still manageable because this much LDL with some medication, with some follow-up properly, you can prolong the lifespan. But if a patient's LDL level is shooting up to 1000 mg per dl, no matter how much you do for their management, you will not be able to save these patients better. That's why homozygous cases are more dangerous. Voice problem, hello. The voice though is working fine beta, I believe. Just a moment. Yes, I believe now the voice is okay beta. I just refreshed it and how माइक खराब हो गया क्या? नहीं माइक खराब नहीं हुआ है, माइक चल रहा है, बिल्कुल चल रहा है. आई एम ऑल्सो कीपिंग दैट विंडो ओपन. वी आर एबल टू अंडरस्टैंड दिस. यस, इट इज फाइन. So heterozygous and homozygous, these are the two type of things that we have to recall better, right? Type 2A, most common type, primary familial hypercholesterolemia. Remember this A beta lipoproteinemia, this particular one beta, A beta lipoproteinemia, this is actually a type of hypolipoproteinemia beta, and this is due to ABC-A1 gene mutation. ABC-A1 gene mutation beta. ATP binding cassette transporter protein A1 gene mutation, and this is A beta lipoproteinemia, where basically we have problems like, in case of this, we have decreased amount of chylomicron, plus we are having decreased amount of LDL, plus decreased amount of IDL, and also decreased amount of VLDL. Please remember, chylomicron, LDL, IDL, VLDL, all these B containing apoproteins containing lipoproteins will be getting decreased. We are discussing about this option B beta. Option B में जो था ना A beta lipoproteinemia, I just wrote one extra point. This is ABCA1 gene mutation beta, and this is where chylomicron, LDL, IDL, and VLDL all four will be getting decreased. Where we'll be also having, due to decrease of chylomicron, the first sign will be steatorrhea that we have heard earlier. Familial combined hyperlipidemia, not that much important question beta. This is just where we have the joint, rise of the level of VLDL, IDL, and our LDL. Familial combined hyperlipidemia, in this question the word combined mainly is meaning that there is not only LDL rise, please remember, LDL rise plus VLDL rise plus IDL is also rising in these patients. This is called as familial combined hyperlipidemia beta. In A beta lipoproteinemia, all these three are decreased. In familial combined hyperlipidemia, these are all increased. And remember beta, Tangiers disease, it is due to, please remember, Tangiers disease beta, this is our HDL level is decreased severely. HDL decreased severely, my dear friends. It is called as Tangiers disease. Yes, HDL is almost zero. Please remember this. Familial combined hyperlipidemia, LDL, VLDL, IDL increase. A beta lipoproteinemia, there is an absence of these guys. Along with these three, also chylomicron deficiency. Tangiers disease beta, it is due to HDL deficiency. Serum HDL is almost close to zero, where we get to see something called as orange yellow tonsils. Orange yellow tonsils is also seen in case of Tangiers disease. Those image based questions we have also discussed in our classes beta, orange yellow tonsils. And in case of A beta lipoproteinemia, you get to see something called as acanthocytes in our peripheral blood smear, spiny projection containing RBC. Acanthocytes are seen in option B, A beta lipoproteinemia. Orange yellow tonsils are seen in case of Tangiers disease. This is in case of hypo alpha lipoproteinemia. Hypo alpha lipoproteinemia. All of you are right beta, all of you are right. So remember this question. With this quickly we have discussed about this. In primary familial hypercholesterolemia, this is the most common type, most fatal type, autosomal dominant, receptor deficiency for LDL. It is of two type, homozygous, heterozygous. Homozygous is a killer which will not give you time to treat the patient, because the LDL alone will be around 1000 mg per dl. This patients guarantee के साथ मर जाएगा. These patients you will not be able to salvage at all. Heterozygous patients, you can prolong their lifespan. You can delay the death. You can prolong their lifespan for almost up to 30, 35, 40, even 45, 50 age में भी लोग जिंदा रहते हैं कभी कभार in case of heterozygous. Homozygous is more dangerous, right? Important point. Try to understand this. Going to the fourth question. Going to the fourth question, beta. Fourth question को देखते हैं. I hope now the voice is clear and everything is working fine. Let's hope it stays that way. फोर्थ क्वेश्चन बेटा, फोर्थ क्वेश्चन में आइए, फोर्थ क्वेश्चन में आइए बेटा. फोर्थ क्वेश्चन, व्हाट इज दिस फोर्थ क्वेश्चन? यस, easy question, but please read. Please read. Hello, please read. Please read, then answer. Don't jump the gun. बंदूक लेके मत बैठे रहिए. Yes, 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 yes. All of you are right, my dear friends. All of you are right. All of you are right, बेटा. All of you are right. Yes, 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 yes. Yes, हम लोगों ने पढ़ा था नी 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 gout. Ropo pseudo ni gout. We have studied this point beta. Ropo pseudo ni gout. In this question, my dear friends, we can all try to relate to this. Yes, history. Postmenopausal female. Okay. History. Please remember, lost her husband due to a road traffic accident. She goes into depression, starts consuming alcohol daily. Last 1 month. Alcohol daily last 1 month. My dear friends, rush to the hospital, complain of excruciating pain in a lower limb with inability to even stand since last 3 days because there is podagra. There is swelling, podagra of the first metatarsophalangeal joint where great toe swells up and the pain will be unbearable pain where the patient will not be able to maintain their body weight as well, and whenever she tries to stand she will fall on the ground. She will fall on the ground because यहाँ पर जो पेन होगा ना बेटा, the pain will be काफी दर्दनाक पेन होता है, excruciating joint pain, इतना दर्द होता है कि आंखों से पानी निकल जाता है बेटा. And please remember, the patient will not be able to stand properly on the ground, they will be falling on the ground. And that's the reason, my dear friends, try to understand, it is actually in the location is also important, and pain is now more localized around the great toe, and there is also some swelling. This sort of swelling is actually called as podagra. इसी swelling को आप लोग बोलते हो by a name which is called as podagra. And please remember that microscopy में क्या दिखेगा, we have to go for arthroscopic, because in terms of acute gout, this is a case of chronic or acute gout. Hello, chronic or acute gout. This is a case of acute or chronic gout, beta. This is a case of acute gout. Yes, this is a case of acute gout. And that's the reason, my dear friends, we should never ever go for uric acid estimation in this patient. Please remember, acute gout, never do serum uric acid level. Never ever do. Yes, all of you are right, beta. Never ever do serum uric acid level. This is a mistake that many clinicians in India do because they don't try to take the history properly. Please, if you take a proper history, if it is a case of acute gout, sudden unbearable pain, sudden onset pain in the great toe, acute gout. Chronic gout, pain will be in the knee joint. Acute gout, please remember, this is the one that will go for podagra. Acute gout. Acute gout will be mainly going for podagra beta. So in this, we have to basically go for needle aspiration, and under microscopy, you will be seeing something called as needle shaped with negative elongation. This is the right answer to this question that we have to remember. Remember, rhombic ones are actually with positive elongation, and these are seen in case of pseudo gout. And in pseudo gout, please remember, there will be sudden onset pain. In pseudo gout, there is sudden onset pain in knee joint. What are the two different type of crystals, beta? In case of pseudo gout, we have got different crystal, beta, that is called as CPPD crystals. Yes, all of you are right. I believe all of you remember, beta. CPPD crystal, calcium pyrophosphate dihydrate crystals. This is calcium pyrophosphate dihydrate crystal. That's why pseudo gout is also called as pyrophosphate arthropathy. Baap re baap, what is this name, sir? Pyrophosphate arthropathy. Yes, try to remember this other name. This is also known as pyrophosphate arthropathy, because the crystal is calcium pyrophosphate. By chance they might give you a bouncer, pseudo gout ke jagah par they might use the word as pyrophosphate arthropathy, and that will be also going for pseudo gout. Here we have ropo, pseudo, knee gout, that we have studied in our classes, that we have to remember, beta. This is a very, very important. Please remember, pyrophosphate arthropathy, sudden onset pain in the knee joint. In acute gout, pain will be in the first metatarsophalangeal joint, sudden onset pain. Here it will be in the knee joint beta. Two different one that we have to remember beta. Acute gout, chronic gout. Yes. These are the crystals, my dear friends. Try to understand this. This actually the classical appearance of the monosodium urate crystals. Monosodium urate crystals. Monosodium urate crystals. Try to understand. In this image, we can all easily try to focus over here in this image that yellow color crystals are mainly horizontal over here, beta G, and in this one, basically these are perpendicular. These are the two image that we have monosodium urate MSU crystals for this. And please remember here also the same image beta, अलग कुछ नहीं है. This is also monosodium urate crystals. Okay, second one is also for gout, not for pseudo gout mein this orientation will be different. Blue will become horizontal, yellow will become perpendicular. Yes, polarized microscopy. Kya baat hai? Polarized microscopy, great word. Try to remember this. Hope this is crystal clear to all of you. Try to remember two images. Don't panic, but both of them look at the orientation. Blue perpendicular, yellow horizontal. It is, please remember, it is going to be a case of gout beta. Gout. Coming to the fifth question. आगे बढ़ते हैं, आगे बढ़ो, चलो आगे बढ़ते हैं. Yes, question number 5. What is the answer of this? This question, let us try to see this. ये तो चॉकलेट क्वेश्चन हो गया. ये क्वेश्चन नहीं देना चाहिए था मुझे, चॉकलेट क्वेश्चन, बट लास्ट एग्जाम में तो आ गया था चॉकलेट क्वेश्चन. आंसर. All of you are right, my dear friends. क्या बात है. Please try to understand that this is a case of LNS. All of you know without any doubt, my dear friends, all of you know it is LNS case, Lesch-Nyhan syndrome. That is a complete deficiency of the HGPRTS, hypoxanthine guanosine, for hypoxanthine guanine phosphoribosyl transferase, HGPRT. Please remember the classic appearance is like this. ये जो बच्चा है ये हर किसी का ले रहा है. अरे बाप रे बाप, क्या है? What is these things, my dear friends? Please remember, getting involved in frequent fights with his classmate. घूम घूम के सबका ले रहा है बेटा. Please remember. And there is also overall aggressive behavior, poor concentration to study, because whenever your focus is on Lena, then you cannot focus on Dena. Please try to understand, my dear friends. That's why this child is often getting, involved in frequent fights with the classmates over here. Try to understand. ले रहा है, ये जो बच्चा है खुद ही खुद का ले रहा है, खुद ही खुद का लेगा. That's the point. And because this child, why खुद ही खुद का लेगा? Because this child will often have a tendency to mutilate, my dear friends. Self mutilation is the key over here. Mutilation of the body parts, particularly fingers and lips. Particularly that particular child will be trying to bite the lower lips more frequently than the upper lip. That's why sometimes the lower lip can also even vanish, that we have discussed in the classes. And these patients also are the problem of the salvage pathway. LNS beta, this is an salvage pathway problem. Salvage pathway is not able to work properly, and salvage pathway is also related to our uric acid. That's why these patients are also going to have knee joint pain, and that's why LNS, maybe we are also going to see the incidences of gout. So this is a case of gout, my dear friends, which is not due to the normal conventional gout, but it is due to the case of Lesch-Nyhan syndrome. Yes. Try to remember these two images are taken from our biochem workbook. We all know sometimes it is restricted only to the fingers mutilation. You can see the nail beds are exposed. Usually this sort of things are restricted to the cases of mild. ये जो first वाला image हम लोग देख रहे हैं ना बेटा, this we can remember in case of mild disorder, in case of mild. But if this disease or if this condition, my dear friends, are taking to the next level, then you are able to see the entire lower lip has gone missing. ये जो बच्चा है किसी और ने इसका नहीं लिया है, खुद ही खुद का लिया है. Please try to remember this point बेटा. There will be a tendency to mutilate the own body parts. That's why this is going to be a case of severe. And in these patients, you cannot leave the hands and the feet of that boy separately. Please remember what we have to do. We have to tie the hands and tie the legs and make them fall lie in the hospital ward. This sort of patients who are trying to go for too much of self mutilation, please remember you have to also put some clip over the mouth so that they can't bite. We'll try to put some clip over the upper jaw so that they can't bite the lower lip, as well as we'll try to tie the hands, both the hands as well as the legs, so that they don't try to go for any movement. Please remember the points of this we all can remember. बांध देंगे इसको बांध देंगे. क्या बात है, इसको बांध देंगे, रोक दिया जाएगा इसको. एंड रिमेंबर द हिंट इज दैट सेल्फ कॉन्फिडेंट men get heavy success. The mnemonic goes like this beta. Self-confident men get heavy success. In this self-confident men, self से हम लोग याद रखेंगे बेटा. The first important point is self-mutilation. खुद ही खुद का लेगा. Self-mutilation is one of the hallmark word and probably the most important word in our discussion. Self-mutilation. Try to remember this. Then we also have confident. Confi से हम लोग याद रखेंगे C से we have got chorioathetosis plus dent से D से हम लोग याद रखेंगे there is chance of dystonia. Chorioathetosis and dystonia. Yes, chorioathetosis, dystonia. मेन से हम लोग याद रखेंगे दिस पेशेंट्स कैन प्रेजेंट विद मेंटल रिटार्डेशन. ऑब्वियसली मेंटली रिटार्डेड चाइल्ड, दिस इज अ मेंटल रिटार्डेशन बेटा. एमआर प्लीज रिमेंबर. ई से याद करेंगे एक्सट्रीमली हॉस्टाइल मेल चाइल्ड बेटा. दिस इज possible to be seen in case of male children. And N say you guys will remember beta nephrolithiasis simply means kidney stones. And these patients can also come to you with a complaint of decreased urinary output, and whenever they are trying to micturate, this boy will also tell that there is a pain or burning sensation whenever they are trying to micturate. Please remember, during micturition, during the passage of urine, there is also pain associated with this nephrolithiasis. Kidney stones at an early age. Nephrolithiasis can be also seen in these patients. G से हम लोग याद करेंगे बेटा gout. That's why joint pain. H say they might not go till gout, but they will definitely show you features of hyperuricemia, and usually this sort of child will be actually a spastic child beta. There is also chance of spasticity. Please remember spasticity beta. Spasticity is an important word. So these are the points. Try to remember beta. Let me be Mr. India for some time so that all of you can look at this image and look at this PowerPoint very nicely beta. Very very important point. Try to understand. Self-confident men get heavy success. Self से self mutilation, confident से chorioathetosis, dystonia, men से mental retardation, extremely hostile male child, and nephrolithiasis, kidney stone at an early age. G से gout, H से hyperuricemia, success से याद करेंगे spasticity. These are the points that we have to remember. Uric acid stones. Yes, in this case you have uric acid stones better. To some extent monosodium urate only. Monosodium urate can be also seen in these patients because there is hyperuricemia, and whenever uric acid is high and if you consume alcohol, then there is a crystallization. In this patient they will be not consuming alcohol, but the hyperuricemia is so persistent that some of them will be again getting converted to this. Usually in case of Lesch-Nyhan syndrome, the pain will not be much in that metatarsophalangeal joint, not in the grade 2. Try to look at that question one more time. As you have asked, these patients are complaining mainly of knee joint. This is a case of knee joint pain. So this is resembling like chronic gout, knee joint pain, not in the grade 2. Grade 2 bola hai to it will go for mainly the acute gout, grade 2 acute gout, right? Adenosine deaminase deficiency, try to remember some extra point. Adenosine deaminase deficiency, it is called as SCID. What is SCID beta? Severe combined immunodeficiency, where there is a joint loss of both our T lymphocyte, B lymphocyte, and even natural killer cells. In these patients, the chance of pneumonia will be more predominant, and the most common cause of death also will be pneumonia. ADA deficiency, adenosine deaminase. ऐसे मेरे तरफ मत देखो, don't look at me like that. ADA means adenosine deaminase deficiency is called as SCID, and the treatment of this we have studied in our class, that this is going to be treated only by gene therapy. And in the whole world, first time, my dear friends, gene therapy was done for the treatment of this ADA deficiency called as SCID. Please remember, APRTS deficiency can also lead to a disorder which is a PG level topic. That's why I'm not touching that. Acid maltase deficiency, all of you have already understood and answered in the chat section that this is called as Pompe's disease. Acid maltase is a Pompe's disease, which is a type of glycogen storage disorder, and it is the most fatal type of glycogen storage disorder, where the child will die before the age of 2 years. Before the age of 2 years, yes. First time gene therapy was done for the treatment of this Pompe's disease is a most fatal. And please remember, acid maltase is another disorder which can be also treated by gene therapies or enzyme replacement therapy. This is another disorder which is also treatable by enzyme replacement therapy. Treatment में हम लोग याद करेंगे enzyme replacement therapy. L-glucosidase alpha is the name of the enzyme that can be given to save this child of acid maltase deficiency, Pompe's disease. Pompe's disease type 2A. Type 2B is called as Dannon's disease, which is a PG level topic. This is acid maltase deficiency, Pompe's disease beta. It is actually a type 2A. Type 2A is the glycogen storage disorder over here, most fatal. Cardiomyopathy, yes. Cardiorespiratory failure, cardiopulmonary failure will be there in these patients, right? We have seen this question. Hope you remember this extra additional info and try to look at the 6th question over here. छठा वाला क्वेश्चन में आते हैं. ओके, छठा वाला क्वेश्चन आंसर आराम से पढ़ के आंसर करना है. नो नीड टू रश, वी हैव टाइम. Yes, Janvi, you are also right. Alpha 1,4 glucosidase deficiency, also known as acid maltase deficiency. क्या बात है, big thanks to you. Yes, let us see this. हाँ, all of you are thinking in the right line. क्या बात है, सही जवाब आ गया. फिर से सही जवाब, क्या बात है, फिर से सही. Please remember, my dear friends, look at this question. All of you are right. Medicine OPD, recent complaints of poor concentration to work, as well as frequent forgetfulness of the works assigned to him and slow bodily movements since he has attended a friend's marriage almost 3 weeks back. And the case also is referred to psychiatric OPD, where amnesia, mental confusion, and dementia and delusional behavior is also noted, my dear friends. Amnesia, dementia, these words, many of you might think the answer will go for Alzheimer's disease, but no, this is not a case of Alzheimer. No, not a case of Alzheimer's disease. Because please remember, workup revealed the case to be a fatal form of food poisoning due to consumption of infected meat, my dear friends, infected beef, infected mutton. These can lead to a disorders group which are called as Prion disease. Yes, Prion disease. Within 1 year, the patient will be dying. Within 1 year, there will be severe brain damage and the patient will not be salvageable, my dear friends. There is also some variants of Creutzfeldt-Jakob disease. The answer of this question is actually this. Creutzfeldt-Jakob disease is the answer of this question. And please remember, there are some types of Creutzfeldt-Jakob disease as well. There is called as variant type, neo variant, NVCJD. There is something called as NVCJD. Baap re baap. NVCJD. Neo variant Creutzfeldt-Jakob disease, and in this it is the one of the very much fatal type of disorders where the patient will be dying within 6 months to 1 year age. And these patients, if it is a mild variety of Creutzfeldt-Jakob disease, beta, usually it might be a self-limiting disease if they have consumed little bit of infected mutton or infected beef in that party, because sheep is the carrier, even the cows, where it is called as bovine spongiform encephalopathy, which is also called as mad cow disease. Mad cow disease. If they have eaten infected beef in that party, then my dear friends, they can also get this disorder. Please remember, this sort of Creutzfeldt-Jakob disease can easily transmit from one person to another person. Let's say needle prick injury. Hello, listen to me very carefully. Needle prick injury. A patient would have got this Creutzfeldt-Jakob disease. You take the syringe, by mistake it pricks your own hand. Like hepatitis, all of you know, hepatitis can easily come due to the needle prick injury. Creutzfeldt-Jakob disease can also come to us through the needle prick injury, beta. Please try to understand, Creutzfeldt-Jakob disease will find its own way to cross species barrier. During the classes, we have also heard the story that there is a concept of zombie disease, zombie movies. And we have seen that if you do not burn the dead body of this person properly, if it is not incinerated at a high temperature, then if the dead bodies are lying somewhere, and if the stray dogs or the stray cats, stray animals try to eat on the human dead body, dead carcasses, even from the human dead body, it can go and invade the other species as well, my dear friends. Mass disasters. Yes, that's the word. All of you are telling the right. It is mass disasters, and all these problems are due to the abnormal folding of proteins in our brain. And in case of Creutzfeldt-Jakob disease, the problem is that alpha helix is okay. Please try to understand in the secondary structure, but the beta plated sheets are abnormal. In these patients, Creutzfeldt-Jakob disease, please make a note of this, beta. Please remember, we have got something called as abnormal beta plated sheets in the secondary structure, due to which misfolding of proteins will not allow the proper tertiary structure. Tertiary structure will not be possible to get formed properly. Chaperones to some extent, they will try to correct this disorder, but chaperones alone are not enough, because there will be a faster misfolding, and these patients can also go for this. Please try to understand, Alzheimer's and Parkinson's also are due to some abnormal folding. Alzheimer's, we have heard about tau proteins, tau. There was a tau called as hyperphosphorylated tau, as well as beta amyloid precursor proteins, beta apps. And Parkinson, you would have heard about Parkin protein and alpha synuclein are the types of abnormal protein. Fatal familial insomnia, this is also the second most common type of human disorders of Prion disease, where different parts of the brain will be getting affected, mainly the thalamus part. In case of Creutzfeldt-Jakob disease, it is our cerebral cortex becomes like sponge. That's why all of you have already answered in the questions that this sort of Creutzfeldt-Jakob disease, my dear friends, it is also called as TSE. What is TSE? TSE stands for transmissible spongiform encephalopathy. Transmissible spongiform encephalopathy. Transmissible spongiform encephalopathy, where basically cerebral cortex, my dear friends, is taking a hit. Transmissible spongiform encephalopathy, TSE. And please remember, in case of Alzheimer's, we know the 2 points. Let me write it, beta. Alzheimer's disease के लिए we have hyperphosphorylated tau, plus beta amyloid precursor protein or beta apps, beta amyloid precursor protein. For Parkinson's disease, all of you know, we have got Parkin and alpha synuclein. For Parkinson's, mainly try to remember the name of alpha synuclein. Alpha synuclein, alpha synuclein, yes. And tau proteins, hyperphosphorylated tau proteins is the answer, but not the normal tau beta. We have discussed in the class, it is hyperphosphorylated, है ना? We have studied this, yes. Hyperphosphorylated tau protein, hyper word is important. Hyperphosphorylated tau proteins. And please remember, we have chance of neurofibrillary tangles formation, which will decrease the acetylcholine production. That's why there will be chance of memory loss. And beta apps can get deposited in the hippocampus, where it will also associate with their long-term memory as well, right? These are the points that we need to remember. It is a case of Creutzfeldt-Jakob disease. It is a form of higher varieties of food poisoning, where the patient can even die if not properly taken care in time. Coming to question number 7. Question number 7. Yes, this is easy. This is easy. Some chocolate questions. थोड़ा सा क्वेश्चन को पढ़ के आंसर करेंगे. Yes, 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 yes. All of you are right. All of you are right. All of you are great, बेटा. Great, great, great. 12 जनवरी को हम लोग एकदम फाड़ के आएंगे, एकदम फाड़ के तोड़ के एकदम सब कुछ करके आएंगे यार. एग्जाम के दिन एकदम फोड़ दिया जाएगा. उसके बाद गोवा जाएंगे. उसके बाद गोवा जाएंगे. Okay. This question, my dear friends, all of you are thinking in the right line. Frequent fractures in the right lower limb. Third time, dad added sustained fracture by orthopedic doctor suggested no external cast is required. Osteogenesis imperfecta patients are also called as brittle bone disease, where there is a frequent chance of fractures, my dear friends, and usually external cast, splint, K-wire, nail, open reduction, internal fixation, or if all these things are not required most of the time in the patients of osteogenesis imperfecta, because these are self-healing type of fractures. And please remember, that is occasional pain that will be also associated, because there will be some osteophytic growth. Will be associated. Painkillers for the occasion pain you have to manage. And please remember, the child also has got blue sclera. Blue is discoloration of the sclera. These two alone actually is important for the diagnosis of the osteogenesis imperfecta beta. Yes, all of you are right. The answer definitely is going to be option number B, osteogenesis imperfecta. This is all of us know. Let us see some important points that we have seen during the classes one more time. This is most commonly collagen 1A1 gene mutation. Collagen 1A1 gene mutation is the most common type of mutation. Collagen 1A1 सलोनी, और एक बार एक 1 को ऐड करेंगे यहां पर 1A1 कोलाजिन 1A1 दो बार एक लिखा है मैंने, दो बार एक 1A1. This please remember, it can be of different types, but out of all the different types of gene mutation, it is 1A type of 1 gene mutation that is the most common type of things. Type 1 collagen will be defective in these patients. In this patient, this is also called as the brittle bone disease. This is also known as brittle bone disease, where there will be frequent fractures in the bone, but this will be self-healing type of fractures, external cast. But brittle bone होने के बावजूद भी हम लोग पॉइंट याद रखेंगे बेटा, this is actually a self-healing fracture. Point to remember बेटा, this is actually a self-healing, है ना, हम लोगों ने पढ़ा था इसको. Self-healing type of fractures. Self-healing type of fractures, right? Self-healing अपने आप जुड़ेगा, but it will come and fuse with an type of osteophytic growth, not the true bones, not the true bone. Osteophytic growth will be able to join them, from where again from that site it can break easily. जहां जहां फ्रैक्चर होता है वहीं से दोबारा फ्रैक्चर होने के चांसेस बढ़ जाते हैं इन दिस पेशेंट्स. वहां पर जुड़ तो जाएगा, but it will be like an osteophytic growth which will not be done by a true bone. As it is not done by a true bone, that's why there will be also chance of frequent fractures, self-healing fractures. But the point to be noted, these will be frequent fractures from same site, frequent fractures mainly from the same site. This is a point that we have to understand. Yes, osteogenesis imperfecta, autosomal dominant type, all of you know that inheritance pattern. I'm not going for this. See, these are the points that we have already discussed in the class. Ehlers-Danlos syndrome, basically there is a collagen 5A1 gene mutation. Collagen 5A1, Ehlers-Danlos syndrome, my dear friends, in EDS, we basically have problems with hyperstretchability of the skin, hyperstretchability of the skin, hyperflexibility of the joints, hypermobility in the joints, all those points. That is due to collagen 5A1 gene mutation, beta. Coming to this collagen, after this homocystinuria, my dear friends, we have studied, it is also having some problem associated with the collagen vascular disorder to some extent, and we have studied the mnemonic in case of homocystinuria. This is mainly due to deficiency of CBS, due to deficiency of cystathionine beta synthase enzyme, or it can be due to deficiency of, we have studied that B6 or B9 or B12 deficiency can also go and cause deficiency of B6, B9, B12, or deficiency of cystathionine beta synthase or CBS deficiency can also go for causing homocystinuria. We have studied a heart full of, that is for glycine, but what was the mnemonic for this one? Homocystinuria, they look as Marfan but also show other great complication. What was the mnemonic we studied? They look as Marfan but also show other great complication. Homocystinuria is a very, very important topic, beta. It is an expected question area as well. Do read about it. Very, very important. In our classes, we have also discussed about that, beta, multiple times. Please remember, we have got a lot of things common between homocystinuria and Marfan syndrome. That's why the mnemonic was they look as Marfan. They look as Marfan but show other great complication. Marfan syndrome, beta, it is due to fibrillin 1 gene mutation. Fibrillin 1 gene mutation. Marfan syndrome, beta, it is due to fibrillin 1 gene mutation. Fibrillin 1 gene mutation. EDS, osteogenesis imperfecta, homocystinuria, Marfan syndrome, all of you are look as Marfan. Yes, please remember. इसके सब कुछ बड़ा होगा, यस, सब कुछ बड़ा होगा, ओके, चलो ठीक है, ठीक है। दीज आर टॉल स्टेचर, लोग बड़े होते हैं उनका लंबा होता है, ऐसा जरूरी नहीं होता है। प्लीज रिमेंबर, इंपॉर्टेंट पॉइंट। मार्फन सिंड्रोम, जोक्स अपार्ट भाई, यूट्यूब लाइव है, अब तो बग्स दो मुझे यार, ये क्या है। प्लीज रिमेंबर, होमोसिस्टिन्यूरिया, मार्फन सिंड्रोम, फिब्रिलिन 1 जीन म्यूटेशन। ठीक है, इसको एक बार याद कर लेना है बेटा। होमोसिस्टिनुरिया मार्फन सिंड्रोम पढ़ के जाना। मार्फन का निमोनिक ऑल ऑफ यू नो इज मार्फन एंड इट हैज बीन डिस्कस्ड इन पैथोलॉजी एज वेल एज इन बायोकेमिस्ट्री, बेटा। ठीक है, इसको एक बार देख के जाना है। यस, इंपॉर्टेंट पॉइंट, इसको देख लो भाई, यूट्यूब लाइव है, थोड़ा सा तो देखो। यहाँ पर in this question I wanted to show you some additional images that we have not discussed during the classes. Remember, in this sort of children we also get to see something called as barrel shaped chest. Barrel shaped chest, please remember, in this sort of questions we get to see something called as barrel shaped, yes, barrel shaped chest as well as triangular, barrel shaped chest as well as triangular shaped face. This we have not discussed during the classes, beta. Try to remember this point, beta. This is an additional point that we are discussing during this 25 important live, right? 25 important, एक बार इसको ऐड करना है। बैरल शेप चेस्ट, apart from the histories that we have discussed in our classes, we need to also add up these 2 more extra additional points. Barrel shape chest, please remember, and triangular face. You can all see and see this radiographic finding, beta. In this radiographic finding we all can understand, look at the shape of the chest, it is exactly looking like a barrel. जो कमान जो जिसमें गोली फेंकते थे लोग बहुत पहले जमाने में ड्यूरिंग द वॉर्स एंड ऑल, इट इज लुकिंग लाइक बैरल शेप चेस्ट. लेट मी वैनिश फॉर सम टाइम. Okay, try to understand, this is the barrel shaped chest that we can also see in the patients of osteogenesis imperfecta. Point to be noted, these patients can also present with something called as triangular shaped face, but triangular, this shape is almost like a triangle. Please remember, almost like a triangle. Triangular shaped faces can be also seen in patients of osteogenesis imperfecta. Please remember, important point, try to understand this. Please remember, ठीक है, इसको एक बार देख लेना है बेटा, ज्यादा मस्ती नहीं करते हैं आगे वैसा. एंड एक चीज देखो, ऑल्दो in this image, in this second image, beta, hello, in this second image, can you guys find anything abnormal in this second image, which is also possible to be identified over here? In this image, is there anything extra that we can also remember, beta? In this image, first image, can we try to look for or understand one more abnormality? Who can say? Please remember. Who can say this? इंपॉर्टेंट पॉइंट, इसमें और कोई चीज? ईयर, यस 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 यस, ईयर ईयर ईयर, लो सेट ईयर, यस यस, यू गाइज आर थिंकिंग एंड लुकिंग एट द राइट डायरेक्शन, क्या बात है, यस। इसमें थोड़ा सा ध्यान दीजिए, इन दिस इमेज लुक एट दिस ईयर बेटा, ईयर पोजिशनिंग इज एक्चुअली क्वाइट लो एज कंपेयर टू द नॉर्मल चाइल्ड, ट्राई टू अंडरस्टैंड, दीज आर कॉल्ड एज बेटा लो सेट ईयर्स, दिस इज कॉल्ड एज बेटा जी लो सेट ईयर्स, लो set ears on both sides, bilateral low set ears, थोड़ा सा नीचे की तरफ सेट किया गया, लो सेट, प्लीज रिमेंबर। यस, ऑल्सो हेलिक्स एब्सेंट, क्या बात है, क्या बात है, हेलिक्स थोड़ा सा एब्सेंट है यहां पर, क्या बात है, क्या बात है, लो सेट ईयर्स आर ऑल्सो वन ऑफ द फाइंडिंग दैट वी कैन रिमेंबर ओवर हियर, लो सेट ईयर्स। So in this image, try to gather these three additional info beta: triangular face, low set ear, and barrel shaped chest. These are the three additional points that we are discussing during this YouTube live. Please to remember about this. Bat की तरह दिखता है बेटा, bat ear, bat, बहादुर, please try to चमगादड़ जो होते हैं, चमगादड़, please try to understand, like a चमगादड़, try to understand this. Bat shaped, bat ear, bat की तरह दिख रहा है, triangular face, वो देखो ना पूरा bat shape होता है, please remember, that's why this bat, that's why, yes, already you guys are telling, this is also remember as bat ear, triangular face, ear low set, looks like bat, सिर्फ bat ear ही नहीं है, patient ही पूरा दिखता है bat की तरह, try to remember this point. alien ठीक है, bat बोल दो यार, alien ऐसे नहीं बोलना चाहिए, please remember. अरे बहादुर means it is चमगादड़ in Bengali. Chamgadar in Bengali is called as Badur. Badur is actually the other name of Chamgadar. Try to understand. Bat, Badur, Chamgadar और are same thing. Okay. कभी कभार स्लिप ऑफ टंग हो जाता है, बंगाली में कुछ बोल देता हूं यार। आगे बढ़ते हैं, ध्यान देते हैं नेक्स्ट क्वेश्चन में, आगे बढ़ते हैं। ओके, फोकस ऑन दिस। ये क्वेश्चन का आंसर बोलो। हेलो, कहां गए आप लोग? इधर हो ना? क्वेश्चन नंबर 8। ओके, इसको देख लो क्वेश्चन, आंसर बोलो। प्लीज रिमेंबर क्वेश्चन। यस, 12 तारीख को जादू करके तो आना। ये क्वेश्चन आ गया, आंसर आ गया। अरे क्या बात है, यस, ऑल ऑफ यू आर राइट अगेन बेटा, ऑल ऑफ यू आर राइट। ग्रेट बेटा जी, ग्रेट। पढ़ के आए हो आज, एकदम फाड़ रहे हो एक के बाद एक। एंड ऑल ऑफ अस कैन रिमेंबर बेटा, 10 year old बॉय फ्लेक्स फिंगर्स विथ विच कैन इट फोर आर्म। बाप रे बाप, इसको पूरा घुमा के 4 आर्म तक लेके आ गया। दिस सॉर्ट ऑफ स्प्रिंग लाइक एक्शन, extensibility and hypermobility in the joints. Please try to understand. This is basically seen on the features of Ehlers-Danlos syndrome. All of you are right, beta. B is the answer. Point to be remembered. Mother also add that there is also unusual scarring or taking unusually longer time to heal after a cut. See, this sort of hints, try to understand. ठीक है, all of you can understand and answer, but try to add up this one more additional point over here, beta. Important point to be noted, there is taking unusually longer time to heal. Whenever we were seeing this sort of entities, longer time to heal, my dear friends, people can also try to get confused with vitamin C deficiency, isn't it? Vitamin C deficiency, that is scurvy may be the wound healing, delayed wound healing. Wound will take longer time. Here also it is longer time. Point to be remembered, in case of scurvy, there is also problem with the collagen. Primary structure to secondary structure, there will be problem. So this sort of history can be also used over there. Wound healing, my dear friends, can be also discussed. Delayed wound healing in case of zinc deficiencies. But in this one, please remember there is scarring. Basically, what happens whenever there is any mild cut, these patients will be also having delayed wound healing, and ultimately there will be also unusual looking like scars which are also formed. There is also higher chance of ecchymosis if they scratch or if they rub against any hard surface. Then also there is a chance of ecchymosis or frequent bruising with minor trauma. Please remember, in patients of Ehlers-Danlos syndrome, we have studied one more thing extra in our classes, that there is frequent bruising with minor trauma. Frequent bruising with minor trauma. That's the reason. In case of minor trauma also, they will take longer time to heal because the collagen type 5 is mainly getting damaged over it. In case of collagen type 5 Ehlers-Danlos syndrome, please try to understand this is collagen basically 5A1 gene mutation, that is the most common type. Collagen 5A1. Collagen 5A1. Collagen 5A1 gene mutation is the most common type. बेटा most common type यहाँ पर कौन सा है 5A1. In case of osteogenesis imperfecta, what was the answer? 1A1. This is 5A1. Most fatal will have type 3. Basically, from the Ehlers-Danlos syndrome, we did remember the alphabet as E. Ehlers-Danlos syndrome mein I told you to remember everything with the alphabet E. E, A, B, C, D, E is the fifth alphabet, most common type of collagen defect. But in most fatal EDS, there will be defect of the type 3 collagen. Type 3 collagen defect in the most fatal type of EDS. Yes, this is an important point that we have to remember, beta. Remember, beta, osteogenesis imperfecta we have studied. Chondrodysplasia. Chondrodysplasia, basically, chondrodysplasia, point to remember, beta, this is due to FGFR3 gene mutation. Baap re baap re baap re baap re baap. What is this? FGFR3, fibroblast growth factor receptor number 3. FGFR3 gene mutation. Sometimes chondrodysplasias are actually intermingled with chondro other dysplastic changes. Chondrodysplasia, please try to understand. In this one, this FGFR3 gene mutation, this is actually seen in a special one that is called as achondroplasia. Achondroplasia. This is an extra additional point that we are writing, beta, that we have discussed in the classes. Achondroplasia, yes, kaha gaya? Fibroblast growth factor receptor. Please remember achondroplasia. Achondroplasia, beta, agar ye aa gaya, then the answer will be FGFR3 gene mutation. But other chondrodysplasias, mainly we have type 2 collagen defect. Mainly type 2 collagen defect. But one of the disorder which is included under chondrodysplasia is called as achondroplasia. And in achondroplasia, we have got FGFR3 gene mutation. This is for this, beta. FGFR3 gene mutation is for achondroplasia. It is for achondroplasia. Try to remember this point. This is an extra additional point that we have to try to remember over here. Collagen 3 deficiency can also lead to Ehlers-Danlos syndrome. Collagen 3 deficiency can also lead to Ehlers-Danlos syndrome, beta. Most fatal type of EDS. EDS has got two classifications, Berlin's classification and Villefranche classification. As per those classifications, if you go, type 4 EDS is the most fatal type of EDS. Type 4 EDS is the most fatal type of EDS, and in type 4 EDS we have got deficiency of the type 3 collagen. बाप रे बाप, टाइप 4 EDS के 6 टाइप आते हैं, 1 2 3 4 5 6. आउट ऑफ दैट फोर्थ टाइप EDS is actually fatal type, and in fatal type EDS we have defect of type 3. But the most manageable ones, type of Ehlers-Danlos syndrome, we have defect of the type 5 collagen. Mainly type 5, if not type 3. These two can be asked in our exam. In case of achondroplasia, what do we try to see, beta? Please remember, in these cases, actually the proximal limbs will be shorter than the distal limbs. In case of upper limb, humerus is shorter than radius ulna, and in case of lower limb, femur is shorter than tibia fibula. Proximal limbs are shorter in these cases of achondroplasia. Please remember, achondroplasia में एक चीज लिखेंगे, in these cases proximal limbs are actually shorter. Proximal limbs are shorter than distal limbs. Than distal. ओ ओके, ये तो नया कुछ सीखने को मिल गया. ओके, देखते हैं, इसको लिख लेंगे बेटा. प्रॉक्सिमल लिम्स आर शॉर्टर देन द डिस्टल वंस. उड़ी बाबा, इसको थोड़ा सा याद करेंगे. Achondroplasia is a type of this Marfan syndrome, तो all of you already guys know. I'm not going into much in that particular topic. ठीक है, एक बार इसको देख लेना. Achondroplasia FGFR3 gene mutation. Remember, chondrodysplasias is a big topic बेटा. टाइप 2 कोलाजन डिफेक्ट में बहुत सारे टाइप्स आते हैं. वी कैनॉट रिमेंबर दैट मच ऑफ इनपुट. जस्ट रिमेंबर achondroplasia is a separate question. FGFR3 gene mutation not due to collagen mutation as such. Right, coming to the question number 9. आगे बढ़ते हैं. क्वेश्चन नंबर 9 देखते हैं क्या है ये. ओ क्या बात है. सो यू ऑलरेडी नो. थैंक्स टू सर बेटा फॉर गिविंग यू दैट नॉलेज. थैंक यू सो मच बेटा फॉर लेटिंग मी नो बेटा. Yes, I hope you guys are there. Hello. Yeah, working fine. So the answer. Yes, the answers are coming. Yes, sorry. Take some time. Okay, no issue. Take time. Okay, yes. All of you are right, beta. Please remember complaints of black discoloration for palm, ear lobule. All of you know in patients of Alcaptonuria, basically we have got some word called as uchronosis. What is the word over here, beta? In case of these, all of us should remember that we have got something called as uchronosis. We have got something called as beta uchronosis. And in case of uchronosis, it is a black discoloration of the soft tissues in our body, uchronosis. And try to understand over here, most common site is the pinna of ear. It is the pinna of ear. After that, we have got mainly the cartilaginous structure in our body. Please remember cosmetic reason, palmoplantar pigmentation. Basically, this black discoloration that we are talking about, this is PPP, palmoplantar pigmentation. This is beta, what beta? This is our palmoplantar pigmentation. This is palmoplantar pigmentation beta, due to which there is also blackening, and these blackenings can be removed by the cauterization. That's why they have gone into dermatologists for cosmetic reason. Please remember biochemistry department may refer hua case, and after that in this we are also doing something called as Benedict test with greenish brownish precipitate. I told you repeatedly that in case of Alcaptonuria, homogenesic acid is actually reducing substance. Please do make a note of this beta. In case of Alcaptonuria, HGA, homogenesic acid, it is actually a reducing substance, and that's why it can give you Benedict test also positive. That's why it can give you beta Benedict test also positive. BT यहाँ पर पॉजिटिव होगा, बट यू विल नॉट गेट द रेड कलर, रादर यू विल बी गेटिंग ग्रीनिश ब्राउनिश प्रेसिपिटेट. यहाँ पर जो आएगा बेटा ग्रीनिश ब्राउनिश precipitate will be seen. It is a case of clear cut Alcaptonuria. Point to be remembered, my dear friends, in this type of question, try to look at the option number C. Let us learn something new better. Let us learn something new. C, type 2 tyrosinemia. In this one, type 2 tyrosinemia, try to understand better. Type 2 tyrosinemia, my dear friends, can also present with hyperpigmentation. And these can also be seen over the palm, that is again called as palmoplantar pigmentation. We are discussing point number C, tyrosinemia type 2. Please remember, tyrosinemia type 2, it is also the most common type in India that we have studied better. Most common type. It is also called as something called as Lesch-Nyhan syndrome. It is called as RHS, Lesch-Nyhan syndrome. Lesch-Nyhan syndrome. And remember, in this we have tyrosine transaminase deficiency. TAT deficiency, tyrosine transaminase deficiency, due to which the pathway will be going towards melanin synthesis more. This hyperpigmentation is due to increased melanin synthesis. and this increased melanin synthesis can be also reflected as palmoplantar pigmentation. But in case of tyrosinemia type 2, my dear friends, Benedict test will be negative. This is important. This is how you rule out. This is how you rule out. Sometime there might be also excessive deposition of this melanin over the pinna or the lobules as well in case of type 2 tyrosinemia. Please remember, Alcaptonuria's blackening in this region over palm and over our ear lobules can be seen in another disorder type 2, but you will be ruling out them by Benedict test negative over here, but Benedict test positive in case of Alcaptonuria. Please try to understand this. Important point, it is on this beta. Type 2 tyrosinemia, we have written some extra additional point. These are for type 2 tyrosinemia beta. These are all for type 2 tyrosinemias. Please try to remember this beta. Very, 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 very important point. Try to focus on this beta. Very, very important. Melanin will be increased in these patients. Melanin will be increased, right? Important. Phenylketonuria history, you know now better than me. In those cases, they will be basically mental retardation, mousy musty odor, all those things will be coming there. Argininosuccinic aciduria is a PG level topic. It is a urea cycle disorder, beta. This is a urea cycle disorder. We are not touching it over here. Anyhow, this is a PG level topic. Urea cycle disorder. This is a urea cycle disorder, beta. वो अलग चीज है. The option D. Urea cycle disorder. Please try to understand this important point and try to focus on this. In Alcaptonuria, ferric chloride test also will be positive beta. Yes, ferric chloride test will be positive. In Phenylketonuria also ferric chloride test is positive beta. Benedict test is one such which can easily differentiate between them. Yes, in case of Phenylketonuria and Alcaptonuria both, as you are mentioning beta, ferric chloride test is also positive. Yes, let me write it and help you everyone. FCT, ferric chloride test, it is actually positive for, let me write it clearly better, FCT, ferric chloride test, it is positive for both PKU as well as Alcaptonuria, as well as Alcaptonuria, as well as beta Alcaptonuria. Please remember, ferric chloride test is another Mutra Visarjan test, beta, urinary test that can be done for both PKU and Alcaptonuria, but Benedict test can be actually important. Right, first thing first, इसको थोड़ा सा याद कर लेना है. राइट बेटा जी, होप दिस इज क्रिस्टल क्लियर टू ऑल ऑफ यू. कमिंग टू द नेक्स्ट क्वेश्चन बेटा, ये क्वेश्चन क्या है, कौन है ये, कहां से आया, व्हाट इज दिस क्वेश्चन, व्हाट इज दिस क्वेश्चन बेटा. What is this question? I knew that all of you will be making this mistake. मुझे मालूम था, इसीलिए ये क्वेश्चन मैंने जानबूझ के दिया है बेटा. प्लीज रिमेंबर, इन दिस क्वेश्चन आंसर माय डियर फ्रेंड्स, आंसर माय डियर फ्रेंड्स इज नॉट ए, not A. Please remember beta, in this question my dear friends, answer is not A. This is a wrong answer. This is a wrong answer beta. Answer is not vitamin B3 deficiency. In this case the answer is B6 deficiency. ये पड़ा bouncer, ये पड़ा bouncer. Please remember, this question answer is not B3, it is B6 deficiency. Option number B is the right answer over here. Now why? Try to understand this question. All of you are looking at this image first and all of you are thinking, right, this image is what, Castle's necklace. This image is what, all of us can easily remember, this is the image of our Castle's necklace where there is necklace like pattern starting around. So ऐसा image तो हम लोग B3 में मार्क करते हैं ना, but यहाँ पर बाउंसर दिया है. Watch out for this sort of questions. Try to understand this बेटा. यहां पर प्लीज रिमेंबर डर्माटाइटिस है, ओहो, सो इट शुड हैव बीन B3 ना, नो, डर्माटाइटिस है एज शोन, Castle's necklace over here, typically around the neck, episodic diarrhea, frequent forgetfulness of the works assigned to him. Please remember, episodic diarrhea. See, dermatitis, diarrhea, forgetfulness can be also remembered as dementia. अरे सब कुछ तो मैच हो रहा है, एवरीथिंग इज मैचिंग. तो हमारे पास डर्माटाइटिस है, वी आर हैविंग डर्माटाइटिस, वी आर हैविंग डायरिया, वी आर हैविंग डिमेंशिया एज वेल. सर आप क्या बोल रहे हो, ये सब तीन तो एक साथ आ गया. तो हम लोग तो जानते हैं ऐसे केस में आंसर करके आना है B3 का डेफिशिएंसी, पेलाग्रा. It is a case of pellagra but not due to B3 deficiency, my dear friends. Read the last line of this question. In this question, please remember, urinary investigation reveals that is a raised level of xanthurenic acid, and this is a case of xanthurenic aciduria, and we have discussed in our classes xanthurenic aciduria is seen in case of B6 deficiency, and B6 deficiency patients can also present with pellagra. आया ना बाउंसर, B6 deficiency, my dear friends, can also my dear friends go for this, and B6 deficiency can also cause pellagra. हम लोगों ने पढ़ा था क्लास के दौरान. This is also for pellagra. Try to understand. Here the hint is that there is xanthurenic aciduria. That's why ऐसा image देख के don't jump the gun. Please try to wait and then you answer. Xanthurenic aciduria is seen in case of B6 deficiency only. This is how you rule out whether it is a case of B3 or B6 deficiency. Xanthurenic aciduria अगर दिख रहा है, because we have studied B6 can go and help in the production of the B3. पहले pathway में B6 यूज होता है, then the pathway goes toward B3 production. First B6 is used, then B3 production is possible in the pathway. And if B6 is deficient, the B3 pathway will not even bloody start. That's why actually the pellagra is caused by B3 deficiency, but the cause of B3 deficiency over here is B6 deficiency, which is proven by xanthurenic aciduria. Remember, this image can be also used for heart nerve disease, can be also used for malignant carcinoid syndrome. My dear friends, all these four options that we are seeing over here can lead to pellagra. All four: B3, B6, heart nerve, MCS. Argentaffinoma cases that can be malignant type carcinoids originating from our GI tract, ileum, rectum, appendix. In this area, they will go for excessive production of serotonin. And please remember, as the serotonin pathway will be taking an upper hand, B3 production pathway will be taking an hit. A patients of malignant carcinoid syndrome, they can also present with pellagra. But we call it as pellagra-like symptoms, and diarrhea, dementia, all these things can be also seen in these patients as well to some extent. Heart nerve disease, my dear friends, can also cause pellagra-like symptoms or pellagra, because heart nerve disease is a tryptophan transporter defect. What is heart nerve disease, beta? Heart nerve disease, my dear friends, let me write it over here. Heart nerve disease, please remember, tryptophan transporter defect. This is tryptophan transporter defect, and tryptophan is the amino acid that can go for B3 production. That's the reason, if tryptophan is deficient, if there is malabsorption of tryptophan, you will also get to see pellagra. All these four has the power to give you the same image, my dear friends. Try to understand this. Obermeyer test you do for the heart nerve disease diagnosis, we have discussed in our class. In case of malignant carcinoid syndrome, you have to rule out by 24-hour urinary estimation of 5-hydroxyindole acetic acid. All of you try to understand this. That's why try to understand in this question. If I change the language, urinary investigation reveals raised levels of 5-HIAA, then the diagnosis will change to malignant carcinoid syndrome. Uri baba, same question, same image, only one word I am changing now. Urinary investigation reveals raised levels of 5-HIAA, and the answer will also change to malignant carcinoid syndrome. Try to understand. In this sort of question, if they say that it is now worked up and followed to be a case of tryptophan transporter defect, then the answer will go for heart nerve disease. Try to read this question and try to understand better. Please remember, carcinoid, malignant carcinoid syndromes, these are mainly able to do pellagra. Heart nerve disease can also present with pellagra. B6 deficiency can also lead to pellagra. All these four can lead to pellagra. But please know how to differentiate. All of us have discussed this during the classes. Please do read about the tryptophan metabolism note from the missed biochemistry workbook beta, and you will be through with this sort of question. Same image, same language, 4 questions. Same image, same language, 4 question can be framed over here. Important point, try to understand this. Baba re baba. Okay, what is this question? बाप रे, सर तो आज एकदम फैल के ले रहे हैं कि दे रहे हैं, हम समझ नहीं आ रहा है. चलो जो भी है, देखते हैं क्या है. क्वेश्चन आंसर. yes 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 ये देखो मिक्स्ड आंसर आ रहा है. देखो मिक्स्ड आंसर आ रहा है. आप ही लोग आंसर कर रहे हो है ना. सम पीपल सेइंग ए, सम पीपल सेइंग बी. अरे क्वेश्चन को पढ़ो ना यार, थोड़ा सा पढ़ो ना. व्हाई आर यू जंपिंग द गन? थोड़ा सा पढ़ो यार, पढ़ो आराम से. धीरे से लेना होता है, धीरे से. देना जल्दी है, लेना धीरे से है. ट्राई टू अंडरस्टैंड. इंपॉर्टेंट पॉइंट टू बी नोटेड बेटा. नाउ लुक एट दिस क्वेश्चन. अरे ये तो इजी क्वेश्चन था बेटा, इसमें मिस्टेक नहीं होना चाहिए था. अरे इसमें क्वेश्चन मिस्टेक नहीं होना चाहिए था. दोबारा जो लोग इसको वॉन गियर्क डिजीज बोल रहे हो, ट्राई टू अंडरस्टैंड ओवर हियर. ट्राई टू लुक फॉर दिस क्वेश्चन. एक बार इसको देखो आराम से पढ़ो. 14 days ओल्ड चाइल्ड, ठीक है, न्यूनेट है, सडनली बिकम्स लेथार्जिक आफ्टर ब्रेस्ट फीडिंग विद इन ए मंथ एंड रिफ्यूजल टू सक ब्रेस्ट फीडिंग. अरे भाई, इसी वर्ड से तो आंसर हो जाता. ट्राई टू अंडरस्टैंड दिस क्वेश्चन ओवर हियर. इन दिस क्वेश्चन ऑल ऑफ अस कैन इजीली अंडरस्टैंड ओवर हियर बेटा जी. इन दिस पर्टिकुलर क्वेश्चन देयर इज ए रिफ्यूजल टू सक ब्रेस्ट फीडिंग. ये क्या है रिफ्यूजल? अरे पढ़ो ना यार. रिफ्यूजल, चिल्ला कर गला दर्द कर गया क्लास में, ऑफलाइन बैच में, ऑनलाइन बैच में, बोलते कि भाई रिफ्यूजल वर्ड है तो गैलेक्टोसीमिया की तरफ ज्यादा सोचना है. नाउ ट्राई टू हिंट. वॉमिट्स ड्यूरिंग फोर्स ब्रेस्ट फीडिंग, एक्सेप्ट ग्लूकोज वाटर, एवरीथिंग इज मैचिंग. एंड येलोइश, लुक एट दिस गाय बेटा, येलोइश डिस्कलरेशन ऑफ द स्किन. मतलब ये क्या है? व्हाट इज दिस येलोइश डिस्कलरेशन ऑफ द स्किन बेटा? इसमें आपको बच्चे में दिख रहा है, इसके साथ जॉन्डिस. एंड हम लोगों ने पढ़ा था इन केस ऑफ क्लासिकल गैलेक्टोसीमिया, व्हिच इज द आंसर ऑफ दिस क्वेश्चन, माय डियर फ्रेंड, देयर विल बी राइज ऑफ यूसीबी, कॉन्जुगेटेड हाइपरबिलिरुबिनेमिया. चिल्ला कर बोला, नोट में बोला कि देखो, दिस इज इंपॉर्टेंट. गैलेक्टोसीमिया एक्सपेक्टेड क्वेश्चन. प्लीज ट्राई टू लुक फॉर दिस सॉर्ट ऑफ वर्ड्स बेटा. Yellowish discoloration of the skin. In case of von Gierke disease, there is no jaundice. I told you repeatedly, my dear friends, there is no jaundice in case of von Gierke disease. Never ever. But in case of galactosemia, early presentation will also present with unconjugated bilirubin rise. And they have also pod belly appearance. We have seen pod belly appearance in 2 places in our biochemistry. One is von Gierke, another one is classical galactosemia. People will give you options like this to confuse you. इमेज देख के pod belly, मोटा बच्चा, पेट दिख रहा है, लोग सोचेंगे कि अरे ये तो von Gierke disease है. But no, it is not von Gierke disease. Because in this question, read the question पूरा, biochemistry क्वेश्चन को पूरा पढ़ के आना है बेटा. And this क्लासिकल गैलेक्टोसीमिया ऑल्सो कैन गिव यू पॉट बेली. इसमें भी हमारे पास पॉट बेली तो होगा, बट इन पॉट बेली दिस इज ड्यू टू इंक्रीज डिपोजिशन ऑफ गैलेक्टोज 1 फॉस्फेट. इट इज ड्यू टू डिपोजिशन ऑफ बेटा गैलेक्टोज 1 फॉस्फेट, है ना. दिस इज ड्यू टू डिपोजिशन ऑफ द गैलेक्टोज 1 फॉस्फेट. होप आई एम नॉट ऑब्स्ट्रक्टिंग द व्यू बेटा. इसको आराम से लिख लेंगे, गैलेक्टोज 1 फॉस्फेट. इंपॉर्टेंट पॉइंट जो हम लोग को यहां पर बिल्कुल अच्छे से याद रखना ही पड़ेगा बेटा. गैलेक्टोज 1 phosphate is an important point that we need to remember over here, right? Hope this all of you are crystal clear about this point and there is no confusion in this, right beta ji? Hope all of you are crystal clear in this, right? आपको मन में कोई भी दुविधा इसके बारे में नहीं रहना चाहिए. प्लीज रिमेंबर, प्लीज रिमेंबर. नहीं बेटा, आप बिल्कुल गधे नहीं हो. प्लीज डू नॉट एवर थिंक अबाउट दोस, डू नॉट ever utter those words for your mind. Please try to understand. All of you are great beta. Only thing, you have to stop doing silly mistakes in the exam. All the things that we have studied will be appearing in the exam and you have to be patient, you have to be calm. Look at the screen. If your eyes are burning for some time, try to close the eyes and sit for some 1-2 minutes. You will still have enough time to solve the questions beta. आराम से क्वेश्चन को पढ़ो so that you don't go for any silly mistakes beta. Silly mistake नहीं करके आना है. देखो, pod belly is word that can be seen in von Gierke disease. In von Gierke disease, pod belly is due to massive glycogen deposition that we have studied. But von Gierke disease we have studied that although liver will be seriously enlarged, but in these patients all the liver parameters are usually normal. Bilirubin also will be normal in those patients of von Gierke disease. Liver enzymes ALT, AST, ALP, GGT will be normal. Liver biopsy can only show you this, but usually the gold standard for von Gierke disease what we have studied, it is our Hagma diagnosis in the ABG analysis. Hagma in ABG. That is how you do diagnosis. So two places, two different type of diagnosis beta. Von Gierke disease, pot belly can be seen, but no unconjugated hyperbilirubinemia, no jaundice. If it is jaundice associated with the pot belly in a newborn child, 14 day के जगह पर if they give you the word as 4-day old child, still you will be choosing the answer as classical galactosemia. Please remember, von Gierke disease presentation is actually totally different. Primary lactose intolerance we have discussed during the classes beta. What is the word primary? We have discussed in our missed classes. There are two type of lactose intolerance: primary, secondary. Primary, near total loss of lactase. Secondary, 15 to 20% lactase is present. In primary, as it is a complete deficiency of the lactase, we have to stop the breastfeeding. But in secondary lactose intolerance, as 15 to 20% lactase is present, we will continue the breastfeeding and rather we will encourage the mother for breastfeeding more and more. Please try to understand. Primary, secondary. It was the history. Lactose intolerance causing diarrhea, it will go for primary lactose intolerance. But diarrhea first, then lactose intolerance features are seen. That diarrhea is mainly due to acute gastroenteritis, that will be going for secondary lactose intolerance. What is this Crigler-Najjar syndrome? All of you know Crigler-Najjar syndrome. It is of two types, type 1, type 2. In this, there is a partial deficiency of UGT. What is UGT beta? What is this UGT? UGT means, my dear friends, UDP glucuronide transfer is the word over here is partial deficiency, please. Partial. And this is also known as one more syndrome we have studied in our classes. All of you are right, telling me the right answer, known as Arias syndrome. Type 2 Crigler-Najjar syndrome can also present with unconjugated bilirubin rise at the same age, 14 days, 15 days. इसी रेंज में आता है ये Crigler-Najjar syndrome type 2. And please remember, Arias syndrome is the other name where we can see also this. But in case of Crigler-Najjar syndrome beta, we are not going to see these features of refusal to suck breastfeeding. Crigler-Najjar syndrome will be able to take or accept the breastfeeding without any difficulty beta. So history itself, my dear friends, चीख चीख के बोल रहा है. The answer will go for classical galactosemia. Please remember, type 1 में you basically cannot do much because it is almost 100% fatal and there is a complete deficiency of the enzyme. Like Lesch-Nyhan syndrome, also complete deficiency of the AGPRTS. Similarly, UGT also is completely gone in case of Crigler-Najjar syndrome type 1. In this one, it is the partial beta. यहाँ पर मैंने लिखा है, this is the partial deficiency of UGT. Partial deficiency of the UGT. These patients are salvageable, and for the treatment, my dear friends, we have discussed about the drug which will work for it best, that is called as phenobarbital. This is the drug that all of you will try to remember better. Phenobarbital. Phenobarbital is the drug that we have to, yes, all of you are right. Enzyme inducer treatment. Enzyme inducer. प्राइमरी लैक्टोज इंटॉलरेंस, 4 डिसऑर्डर, ऑल दिस 4 आर फ्रीक्वेंटली आस्क्ड क्वेश्चन बेटा, यही सब क्वेश्चन बार 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 घूम घूम के आएंगे बेटा. So try to focus on this. Phenobarbital is the treatment of choice in the type 2 Crigler-Najjar syndrome. In type 1, basically there is no cure. You cannot save the baby for longer time. Usually they will die within 6 months to 1 year time. Coming to question number 12, आंसर. ये क्वेश्चन अगर किसी ने गलत आंसर दिया ना, सच में घर में जाके पेल के आएंगे, जहां कहीं भी हो. गला दर्द कर गया था बोलते 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 बोलते. ये क्वेश्चन गलत नहीं करना है, पूछूंगा बार 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 बार. All of you should give the right answer. अरे क्वेश्चन को पढ़ यार, थोड़ा क्वेश्चन को पढ़ 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 भाई, पढ़ो, थोड़ा सा पढ़ो, थोड़ा सा पढ़ो. ये कौन है ये लोग यार जो इसको ए आंसर कर रहे हैं? मैं सबका नाम लिख के रखूंगा, अभी सबका नाम लिख के रखूंगा जो कोई भी इसको ए आंसर कर रहा है. अरे यार, दिस क्वेश्चन वी हैव डिस्कस्ड in our weekly test, in our subject wise test. Again we are giving you in 25 most important question because I don't want you guys to miss this question beta. ये काफी बार आया है question. Try to understand the answer of this question is only one thing my dear friend, that is reduced form of glutathione. This is the C is the answer. C is the answer. C is the answer. C is the answer बेटा. ये बार 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 सेम क्वेश्चन रिपीट कर रहा हूं so that you never ever go and do a mistake in the exam hall बेटा. नाउ इसको फाइनल और एक बार देख लेते हैं. प्लीज रिमेंबर इंपॉर्टेंट पॉइंट टू बी नोटेड ओवर हियर बेटा जी. इसमें देख चीज देखो, ये क्या है हम लोगों ने पढ़ा था. ट्राई टू लुक एट द हिस्ट्री. दिस इज द क्वेश्चन दैट दे हैड आस्क्ड इन आवर एफएमजी एग्जाम बेटा. यही क्वेश्चन ऐसे घुमा के पूछा गया था. इसको थोड़ा सा देखिए आराम से. सोलो ट्रैवलर, ओके, आया चाइना से, कहां पर टपका? इंडिया में. कहां जाना है इसको? ऑफ बीट डेस्टिनेशन, ओके. वेयर मलेरिया इज एंडेमिक, वेयर मलेरिया इज एंडेमिक. Before going over there, the new traveler gets scared of the situations in India and he starts taking antimalarial drug chloroquine prophylactically even before going there. And we have studied drugs like chloroquine, sulfamethoxazole, as well as few sulfa group of drugs like those demands, disease modifying anti-rheumatic drugs. Misalazine, sulfasalazine can also inhibit those glutathione reductase enzyme in the pathway, and it can also, we have seen this beta, हम लोगों ने पढ़ा था ये चीज, right? There was an enzyme that was called as glutathione reductase. These can be inhibited by those drugs, chloroquine. It can be inhibited by these drugs. Glutathione reductase can be inhibited by some drugs like chloroquine and so antimalarial drugs, antipyretic drugs like mefenamic acid and so on. And in this case what will happen? NADH plus H plus is 2 hydrogen will not be added with the oxidized form of the glutathione, and ultimately you are not going to produce this guy which is a ब्रह्मास्त्र compound my dear friends. चीख चीख के बोला था क्लास के अंदर. This is the GSH glutathione molecules which we need to keep it constant in the RBCs, otherwise the RBCs will die, because this guy's job is to break down this H2O2 back into a safe compound that is known as water by the help of glutathione peroxidase, which is a selenium containing enzyme. And if you are giving these drugs, then this GSH production will be blocked because this enzyme is actually getting blocked, and ultimately due to the low concentration H2O2 my dear friends will increase, and this H2O2 rise can all remember it can go for production of free radical or reactive oxygen species production, free radical or ROS production, and that can cause damage to the RBC membrane causing rupture or hemolysis. Reduced glutathione, reduced glutathione, reduced glutathione. Please remember this guy's name is called as reduced glutathione, but this is an important guy that we have to remember Reduced glutathione, my dear friends, is a very important life-saving compound for the survival of the RBC. This guy will allow survival of the RBCs for 120 days because it will be able to break down those hydrogen peroxide that can get accumulated in the RBCs, and it can be, yes, important. Hemolytic anemia, all of you try to remember these points that we have discussed. Heinz body's G6PD deficiency, yes, practically in this pentose phosphate pathway, the enzyme that was able to do all these things was known as G6PD. G6PD, my dear friends, actually produces this guy NADPH plus H plus. Similarly, if G6PD, if it is deficient, then also NADPH plus H plus production will not be possible. That's the reason your reduced glutathione production also will not be possible over here. That is the story. G6PD deficiency is the most common cause of hemolytic anemia in India. Most common cause of hemolytic anemia in India is G6PD deficiency beta, glucose 6-phosphate dehydrogenase. That is the rate limiting enzyme of which pathway? Pentose phosphate pathway, which is also known as HMP shunt, right? Important point जो थोड़ा सा याद करना है, right? All those Heinz bodies appearance, HB, those target cells, helmet cells, all the parachute like cells, those word that we have heard during the classes. तो ये क्वेश्चन गलती से भी गलती नहीं करना है, गलती से भी गलत नहीं करना है बेटा, इसको एक बार देख लेना बेटा. This is a question that we have discussed multiple times in our classes. Going to question number 13. फिर से सोलो ट्रैवलर, ये क्या चल क्या रहा है? फिर से सोलो ट्रैवलर, आई डोंट नो व्हाट इज दिस क्वेश्चन. सोलो ट्रैवलर, बाबा रे बाबा रे बाबा. सोलो ट्रैवलर, सब सोच रहे होंगे सर कहाँ कहाँ से क्वेश्चन ढूंढ के लेके आए हैं. आइडिया वही है कि वट एवर लैंग्वेज दे माइट आस्क यू, यू ऑल आर कमिंग आउट लाइक विथ ब्राइट शाइनिंग स्टार्स ऑन दैट एग्जाम डे. अभी लोग थोड़ा सा सोच सोच के आंसर कर रहे हैं, अभी थोड़ा सा कॉशस हो गए कि नहीं भाई थोड़ा सा देख के आंसर करना है, ऐसे ही ब्लाइंडली नहीं देना है. ओके अभी धीरे धीरे आंसर आ रहा है, बट राइट आंसर्स आ रहे हैं. बट इस क्वेश्चन में आपके पास राइट आंसर आ रहे हैं. यस 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 यस, इस क्वेश्चन में राइट आंसर राइट आंसर राइट आंसर. यस, सी बेसिकली the question has been given thoda sa by in a different language, but what is the question in this point? What is the point that we have to remember? Try to look over here. Northern Hills trekking started the trek at 6:30 a.m. yesterday. 6:30 a.m. yesterday and continues ascending up. Great. Okay. Unfortunately, due to some unprecedented avalanche, there he lost his gear where he was having the food. Rescue team finds his team from the avalanche site, extract him by 10:30 a.m. 10:30 a.m. by tomorrow 10:30 a.m. So yesterday say tomorrow. Yesterday and continues ascending up, and person's liver now. Please try to understand in this question. All of you know, yes, we have studied beta 18 to 72 hours. Yes, more than 18 hour to 72 hour we have gluconeogenesis pathway as the backup, and if you count the time, it is well falling before below 72 hour. In this case it is less than 72 hour beta. That's why the answer we will target as gluconeogenesis. Gluconeogenesis is the answer over here. Extract him from the avalanche site by tomorrow. Please remember, in these cases we can all remember it is within 30 days, within 3 days beta, within 3 days, sorry, within 3 days 72 hours. So it will, the answer will go for this, right? So in this sort of question try to understand. 28 hours निकल के आ रहे हैं, 28 घंटा. yes, 28 घंटा निकल के आ रहे हैं लगभग बेटा. 6:30 a.m. to tomorrow 10:30 a.m. That's why try to remember this. 72 hour it will be going for this sort of question. Please remember, for everybody's knowledge, let me write one more extra additional point beta. Glycogenesis, my dear friends, it is up to 18 hour only, up to 18 hour only. glycogenolysis is up to 18 hour only. Ketone body synthesis and fatty acid breakdown, it will be starting after a long time, more than 3 days. More than 3 days, more than 3 days they will be going for. Basically, they ask you question on this glycogenolysis and gluconeogenesis. Gluconeogenesis, right? Question. देख लेना. Yes, coming to this. Question number 14. एवालांच मीन्स वो बेटा कभी कभार पहाड़ों पे जो बर्फ का जो पूरा ये एकदम एक काफी बड़ा जगह से देयर इज विल बी ए लैंडफॉल एंड अलोंग विद द लैंडफॉल लॉट ऑफ आइस डिब्री ऑल्सो विल बी कमिंग डाउन. एवालांच बोलते हैं इसको बेटा. पहाड़ों में अगर जब आप ट्रेक वेक करने जाते हो ना तो एवालांच आ सकता है. इन दोज ट्रेकिंग रूट्स, अन्नपूर्णा बेस कैंप, एवरेस्ट बेस कैंप ट्रेकिंग, पीपल दे ऑलवेज फेस दिस एवालांच. Ketone body maximum is during the second week of starvation beta. Ketone body maximum by second week and maximum beta oxidation after day 3. Okay, in this last question one more time, fatty acid oxidation, please remember more than 30 days maximum is starting, and this is more than 2 weeks. इन दोनों को थोड़ा सा एक बार देख लेना. Coming to this question, yes, answers are already started coming. Yes. All of you are right. Lethargy, weakness, shortness of breath while climbing stairs or walking a mile. 12 lead ECG shows an old infarct. Okay, old infarct हो सकता है किसी में भी on the anterior wall of the heart. Reports that he has never been hospitalized on further working. Unremarkable lipid profile, however, high homocysteine level and urine for methyl malonyl CoA was also elevated. Yes, chocolate question. Homocysteinemia followed by homocystinuria along with methyl malonyl CoA elevation, my dear friends. Answer will go without any doubt for B12 deficiency. Answer will go for beta B12 deficiency. We have studied this beta. Homocysteinemia can be due to B6, B9 or B12. Please try to remember, and over here this is B6, this is B9, this is B12. All these three can cause homocysteine level rise. All these three can elevate the level of homocysteine, no doubt. All these three can increase level of homocysteine. But methyl malonyl CoA, please remember, methyl malonyl CoA, this guy over here, it will be seen only in B12 deficiency. B12, if it is deficient, then only we see methyl malonyl CoA. MMA लोग इसको बोलते हैं शॉर्ट में, मिथाइल मैलोनाइल कोए. MMA is actually going to get increased. What is MMA? मिथाइल मैलोनाइल कोए. मिथाइल मैलोनाइल कोए लोग इसको शॉर्ट में बोलते हैं. MMA will be elevated. Methyl malonyl CoA, right? This is a question. Try to remember. This is the case of homocystinuria due to B12 deficiency. Strict vegan diet. Okay. Question. आंसर 15 तक पहुंच गए हैं. अब भी ठीक करके देता हूं. Answer. Please read. Answer. Yes. All of you are right. Great. This is the diagnosis, beta. What is the diagnosis? We all can remember. This is the diagnosis of the Wernicke-Korsakoff syndrome. अरे गोवा प्लस कॉन्फैबुलेशन. All of us remember this. Answer, my dear friends. In this case, they have asked most specific treatment, beta. Most specific treatment, right? Most specific treatment for this. This is going to be the IV injection of thiamine. Please remember, first we have to go for IV injection of the thiamine, Wernicke-Korsakoff syndrome. Then actually we have to go for IV dextrose and then correct dyselectrolytemia. What is the treatment option on these patients? Please remember, first option C, then B, then A. CBA is the route for the treatment of the patients of Wernicke-Korsakoff syndrome बेटा. इंजेक्शन ऑफ थायमिन देंगे, 5% IV डेक्सट्रोज दिया जा सकता है. We have studied the mnemonic was TBG. TBG was बेटा thiamine before glucose. We have studied TBG stands for thiamine before glucose. TBG क्या होता है? thiamine before glucose, राइट. ये क्वेश्चन जरूर आ सकता है, रिपीट भी हो सकता है बेटा. दिस इज अ क्वेश्चन ऑफ द फ्रीक्वेंटली आस्क्ड एफएमजी एग्जाम. ट्राई टू रिमेंबर दिस. टीबीजी थायमिन बिफोर ग्लूकोज बेटा, इट कैन गेट रिपीटेड. ट्राई टू रिमेंबर टीबीजी थायमिन बिफोर ग्लूकोज. क्या बात है, क्या बात है. टीबीजी वी हैव स्टडीड thiamine before glucose. Then you try to correct dyselectrolytemia, because what happens due to the neuronal involvement now, due to B1 deficiency, we also have problems in the metabolism of the minerals, particular dyselectrolytemia, electrolytes imbalance also will be seen. Hyponatremia, sometimes hypokalemia can be also seen in these patients. That has to be also corrected later. First you correct the major deficiency B1, then you give the glucose load and try to keep the brain functioning, then you can go for electrolyte imbalance correction. CBA is the route. In this particular question, there is no role of B12. Injection of hydroxycobalamin has got no role in this question बेटा. इस क्वेश्चन में यहाँ पर कोई भी रोल इनका नहीं है. No role of B12. Injection of hydroxycobalamin is the antidote for what? Let me ask you a question. What is the antidote used for? IV hydroxycobalamin is the antidote for cyanide poisoning. Please try to understand. Injection of hydroxycobalamin, it is the antidote for actually cyanide poisoning beta. Cyanide poisoning, antidote for cyanide poisoning, right? इसको थोड़ा सा देख लेंगे. Antidote for cyanide poisoning. Yes, Harsh, yes, you are right. Yes, antidote for cyanide. Yes, Ritupriya. Yes, antidote for cyanide poisoning. Yes, all of you are. Alekya, Akshat. Yes, all of you. Cyanide poisoning. It is for cyanide poisoning. बेटा उसको एक बार देख लेना, वो अलग क्वेश्चन है. In real life, you will not get any time to give you this, but for MCQ sake, please try to remember. But IV hydroxycobalamin can technically save these patients. Right? इसको एक बार देख लीजिएगा. Coming to next question, 16th question, number 16. Question number 16. ये क्वेश्चन थोड़ा सा बाउंसर है. प्लीज रीड. इट इज अ बाउंसर, बट डू रीड एंड आंसर आराम से. आई टोल्ड यू ना, इट इज ए बाउंसर, इसीलिए गलत जवाब थोड़ा सा आ रहा है. यस, डायग्नोसिस इज राइट. हर्ष, योर डायग्नोसिस इज राइट. इट इज ए केस ऑफ नॉन क्लासिकल पीकेयू. यस, योर डायग्नोसिस इज राइट, but the answer you mark little bit wrong beta. Please try to focus over here. Although it is a case of non-classical PKU, but the first line management of the phenylketonuria, whatever it might be, is to decrease the amount of phenylalanine in our diet. First line of management is always to stop phenylalanine in the diet. And why there is stop phenylalanine in the diet? Stop phenylalanine, my dear friends, stop phenylalanine is that limiting the substrate for deficient enzyme. What is this? Limiting the substrate. What is the substrate? Phenylalanine. So this question, this option, basically it is telling you to decrease the level of the phenylalanine in our diet. उसी चीज को थोड़ा सा घुमा के लिखा है. Diagnosis right. Diagnosis right. It is a case of non-classical PKU. This is a case of non-classical PKU बेटा. डायग्नोसिस आप सबने सही किया. डायग्नोसिस आप सबने सही किया. नॉन क्लासिकल PKU बोला डायग्नोसिस है. यस, इट इज नॉन क्लासिकल. बिकॉज व्हाई नॉन क्लासिकल? एवरीवन लुक ओवर हियर. नॉर्मल एक्टिविटी ऑफ phenylalanine hydroxylase. ओहो, phenylalanine hydroxylase enzyme is normal, and all of us know PKU is due to the deficiency of this enzyme. So how come it is a PKU? Yes, it can be a case of PKU as well, because in non-classical PKU we have studied there is a deficiency of another enzyme known as dihydrobiopterin reductase. Dihydrobiopterin reductase. डाइहाइड्रोबायोप्टेरिन रिडक्टेज, ये थोड़ा सा टफ क्वेश्चन था बट ओके, ये आ सकता है. DHB, yes, dihydrobiopterin reductase or biopterin deficiency. Yes, in this question basically we need to do two dual therapy. Best option is C, but we should also go for supplementation of oral biopterin. In these patients we have to go for this A also as the answer. In this question two answers are correct. Two answers are correct. If you ask me which is better, yes, in this question C greater than A. C greater than A is the better answer. Oh ho, bouncer, बाप रे बाप, डाइहाइड्रोबैप्टेरिन रिडक्टेस, बाप रे बाप सर ये क्या चल रहा है आज. Dihydrobiopterin reductase, C and A both are right answer, but C is chosen as the best one because stopping phenylalanine is the best treatment modality. We have studied multiple times. It is the best treatment modality. It is taken directly from our workbook notes. Best treatment modality is to lower the intake of phenylalanine. That's why we should ideally stop the breastfeeding as well in these patients. Replacement of the deficient enzyme, it is not available as we speak. Phenylalanine hydroxylase or dihydrobiopterin reductase, these enzymes cannot be done through enzyme replacement therapy. Giving the amino acid through the dietary supplementation. Tyrosine, yes, this is also yes. This is also the right answer. Oh, Are Baba. This D is also the right answer, my dear friends. Yes, C greater than A. और एक चीज ऐड करेंगे, that means then D. Oh, CAD. Yes, B is not available, but C, A, and D all are available. The best answer they have asked during the management, first line. That's why for first line answer will go for C. For first line answer is going for C. Okay. बाप रे बाप क्या है ये? CAD, CAD. Please try to understand. Yes, Indian child looking like a Russian child. किसने किसका लिया? Try to understand. Important point. Important. किसी ने तो किसी का लिया, किसी ने तो किसी को दिया. आगे बढ़ते हैं, देते हैं और ओके. क्वेश्चन 17, खतरा. क्वेश्चन 17, खतरा तो नहीं है. 17 मीन्स खतरा. ओके, 17. क्वेश्चन 17. ये इजी है, खतरा नहीं है रे इसमें. हेलो, कहां गए? इजी है. यस, इट्स स्ट्रेट फॉरवर्ड क्वेश्चन बेटा, इसमें कोई गलती नहीं करेगा. यस, ऑल ऑफ यू आर राइट बेटा. दिस इज इजी क्वेश्चन. दिस इज एक्चुअली इजी क्वेश्चन. कोई खतरा नहीं है बेटा. देयर इज नो नथिंग टू वरी. वी ऑल विल पास. डोंट वरी बेटा. एकदम 12 जनवरी को फाड़ के आएंगे, फाड़ के. फर्स्ट हाफ एकदम धमाक एकदम होगा यार. टेंशन मत लो, होगा. Please remember beta, this is right answer that all of you are seeing. Hint is that underlying cause, my dear friends, over here, point to be noted, that in this question, that underlying cause is inability to perform both glycogenolysis and gluconeogenesis. Please remember, in these two pathways, last enzyme it is same. And what is the same enzyme beta? Glucose 6-phosphatase. Glucose 6-phosphatase is the last enzyme of these two pathway. Basically, this diagnosis, my dear friends, is our von Gierke disease. This is our von Gierke disease. VGT beta, von Gierke, yes. Von Gierke disease beta, von Gierke disease. Yes, this is the answer. Von Gierke disease. That in this problem, the child is not only able to break down the glycogen completely, as well as it is also not able to convert non-carbohydrate sources to go back to glucose, because there will be inhibition of gluconeogenesis. So in this patient, the glucose level is not able to get maintained, because glycogenolysis that was supposed to give you glucose, as well as gluconeogenesis which was also supposed to give you glucose, both the pathways are taking a hit simultaneously. दोनों पाथवे में साला एक ही वक्त पर हिट हो रहा है. दैट्स द रीजन दिस पेशेंट्स विल प्रेजेंट टू यू विथ, प्लीज रिमेंबर, फास्टिंग टाइप ऑफ हाइपोग्लाइसीमिया. हम लोगों ने पढ़ा था दैट द मेजर चैलेंज इन दिस पेशेंट्स इज फास्टिंग हाइपोग्लाइसीमिया इन बिटवीन फीड्स. जब भी बच्चे को दूध नहीं पिलाया जाएगा, इन दोज गैप बिटवीन टू फीड्स, द चाइल्ड कैन प्रेजेंट विद दिस फास्टिंग हाइपोग्लाइसीमिया. चलो मेरा आवाज गूंजता रह जाए टिल 12 जनवरी, उसके बाद भले ही मेरा आवाज भूल जाओ, कोई गिला शिकवा कुछ भी नहीं है बेटा, बट 12 जनवरी तक आपके कानों में मेरा आवाज गूंजता हुआ रहना चाहिए. दैट्स व्हाई आई एम रिपीटिंग द वर्ड्स, रिपीटिंग द सेंटेंसेस मल्टीपल टाइम, सो दैट गूंजता रहे और सही आंसर मार्क होता हुआ चला जाए, एंड ऑल ऑफ यू कैन कम आउट विथ फ्लाइंग कलर्स माय डियर फ्रेंड्स. यस, होगा 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 होगा, जरूर होगा, इसी बार ही होगा. अब की बार 200 पार, अब की बार 200 पार जरूर करके आएंगे एकदम. दिन में एग्जाम को करेंगे, रात को कुछ और करेंगे, उसके बारे में बाद में बात करेंगे, पर्सनली व्हाट्सएप पे बात करेंगे. आगे बढ़ते हैं. In this question, answer. यस 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 यस. नहीं, सब कुछ चीज साथ में नहीं करेंगे, कुछ चीज मेरे बिना भी करना सीखो. हर एक काम के लिए मुझे मत बुलाओ यार. आगे बढ़ते हैं. ये देखो क्वेश्चन का आंसर बोलो यार, मजाक बाद में होगा. ओके, इस पॉइंट को थोड़ा सा देख लेंगे. यस 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 यस, ऑल ऑफ यू आर राइट. यस, थिंकिंग इन द राइट लाइन. नाउ यू नो यू कैनॉट मेक ए मिस्टेक इन दिस वन बेटा. देखो ये सब हिस्ट्री विस्ट्री दिया गया. डर्मेटोलॉजी, ओपीडी, रैशेस 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 ओवर स्क्रोटम स्क्रोटम along with golden color rash called as cradle cap, and anti-dandruff shampoo has been prescribed for the treatment, and some vitamin deficiency. Answer will definitely go for B2 beta. Please remember, in this sort of question, B2 deficiency, we can see something called as seborrheic dermatitis. Seborrheic dermatitis, this is also a type of dermatitis which is mainly seen over the genitalia as well as to some extent over the scalp. Seborrheic dermatitis, please remember, in case of a child, it is seen over scalp plus also over genitalia. Over genitalia we can see this. This is the case of seborrheic dermatitis. Yes, all of you are right, but all of you are right. Riboflavin deficiency. The other features of B2 deficiency, all of you know, those angular stomatitis, cheilitis, cheilosis, swelling, glossitis, magenta red color tongue. But the first sign, it will be circumcorneal vascularization around the cornea. In our bulbar conjunctival vessels, circumcorneal vascularization will be seen better around the cornea. There will be proliferation of the bulbar conjunctival blood vessels. Bulbar conjunctival blood vessels will be swelling up in patients of this B2 deficiency. It is the earliest sign. Try to understand. Magenta red color, all those features which are there. Earlier is early sign. It will be proliferation of the bulbar conjunctival vessels, which is basically circumcorneal vascularization. In case anyone wants to know it again, earliest sign, circumcorneal vascularization. Circumcorneal vascularization. Try to understand this. Earliest sign इसको एक बार देख लेना बेटा. Other most common sign is angular stomatitis, that you already know. ये क्या है? Unfortunate child presented with what is this? Oh my god. bad condition, something. Look at the question and answer. होगा, yes, B. No confusion, no confusion. I believe all of you agree with me. Zinc deficiency, right? Zinc deficiency is the answer. No confusion in this, beta. In this case, it is D, 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 D. Yes, D. 2 to 3 hours, my dear friends. We are changing the diaper, but still, my dear friends, these are actually acrodermatitis enteropathica. All of you know acrodermatitis enteropathica. Acrodermatitis enteropathica. And please remember, there will be problems like diarrhea. There is problems with diarrhea, as well as there will be also dermatitis. There will be dermatitis over, in this case also genitalia, but it is not due to seborrheic dermatitis, beta. This is zinc deficiency dermatitis. And please try to understand, in these patients of zinc deficiency, my dear friends, we can get to see also one more D, that is delayed wound healing. There is also delayed wound healing. In these patients, the wounds will take also is delayed wound healing. Delayed wound healing. Diarrhea, dermatitis hoga, as well as delayed wound healing is the 3D over here, but not the dementia, beta. In case of zinc deficiency, late cases, it can also have some neuronal involvement. बहुत long standing zinc deficiency अगर किसी में होता है तो, but actually zinc deficiency, I mean in the food items that we eat, zinc can get absorbed easily, so उतना severe deficiency नहीं होता है zinc का. So diarrhea, dementia, as well as, I mean sorry, diarrhea, dermatitis and delayed wound healing, but not much of dementia we see in these patients, right? इसको एक बार देख लीजिएगा. Coming to question number 20. Yes, alopecia. Yes. No, I'm just mentioning the 3D letters actually. Okay, इसको लिख देते हैं बेटा alopecia. Alopecia, yes, can be also zinc. Zinc is also important for treatment of diarrhea. Zinc syrups or zinc tablets are prescribed in the treatment of diarrhea as well, बेटा. ठीक है, ये थोड़ा सा बाउंसर है. I am not obstructing the view anymore. You just see the question and tell me the answer. आराम से. लास्ट 6 क्वेश्चंस आराम से पढ़ लेते हैं बेटा जल्दी से. अब भी ठीक करके दे देंगे. ये क्वेश्चन क्या है? Yes, copper deficiency also to some extent it can go for delayed wound healing, beta. Copper to some extent, because copper is important for the collagen synthesis. C for C. Copper is important for the collagen cross linking. Yes. So if there is copper deficiency, to some extent we can also go for delayed wound healing to some extent. But vitamin C is more important. Zinc is more important for delayed wound healing. But copper में भी दिख सकता है, दिख सकता है. ये थोड़ा सा बाउंसर है. यस, थोड़ा सा ध्यान देके पढ़ेंगे तो आंसर आएगा. थोड़ा सा ध्यान देके पढ़ेंगे इन क्वेश्चन में. ये बाउंसर है, पहले ही बोल रहा हूं, बट मिस नहीं करना है बेटा. डू नॉट मिस दिस क्वेश्चन. थोड़ा सा टफ है, बट सोचो. यस, ऑल ऑफ यू आर थिंकिंग इन द राइट लाइन बेटा. क्या बात है, ऑल ऑफ यू आर नाउ थिंकिंग इन द राइट लाइन. द आंसर इज कमिंग राइट. आंसर इसमें सबसे पहले मार्क करते हैं बेटा, ताकि आंसर मार्क में कोई गलती ना रहे. दिस इज आवर दिस. यस बेटा, यस 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 यस, दिस इज द क्वेश्चन आंसर बेटा. ये है इसका आंसर. दिस इज द आंसर बेटा. दिस इज द आंसर ओवर हियर, राइट. ये सही आंसर, ये सही आंसर है. ऑप्शन नंबर सी. What they have told actually in this question, what they had told in this question. Point to be noted over here. Oh no, sorry. Answer here is not C. Sorry. No. Sorry. I also got carried away. See, that's what we have to read the question properly. देखो, इसमें आंसर डी है. ओके, इसमें आंसर डी है. ओ माय गॉड, ये क्या हो गया? ये तो गलती कर दिया, सर ने भी गलती कर दिया. यस, दिस सॉर्ट ऑफ मिस्टेक्स वी कैन डू इफ वी डू नॉट रीड द क्वेश्चन फुल. I know all of you are thinking in the right line. All of you are thinking in the right line that in this question, basically, there is something relation to emergency, consciousness lost, CBG is very low. That means it is a case of hypoglycemia. That's why the child has been put on bolus of D10. Point to remember, it is a case of medium chain acyl-CoA dehydrogenase deficiency. So basically the diagnosis over here is MCAD deficiency. MCAD deficiency. उरी बाबा मिस्टेक ब्लंडर ये सब हो गया, सिली मिस्टेक को रोकना है. इसीलिए देखो MCAD deficiency case, all of you are thinking in the right line. And this MCAD, medium chain fatty acids, we all know medium chain fatty acids are coming from the breastfeeding. These are actually coming from breastfeed. We all know these are coming from breastfeeding, and these medium chain fatty acids are actually in the breastfeeding. Human breast milk actually has got 10 to 12 carbon, and they can give you a huge number of ATP because medium chain fatty acids are supposed to break down to form acetyl-CoA. Now, what is the link of acetyl-CoA and the blood sugar level? Try to understand. We have discussed during the classes that acetyl-CoA never ever go to get converted to glucose ever, because acetyl-CoA can never ever get converted to pyruvate. That's why acetyl-CoA himself is never converted to glucose. But during the gluconeogenesis first step, my dear friends, what will happen? We have discussed that there is an enzyme called as pyruvate carboxylase, and the allosteric activator of pyruvate carboxylase enzyme is known as acetyl-CoA. Although acetyl-CoA himself is not contributing directly towards glucose production, but without acetyl-CoA, you cannot even start gluconeogenesis in the first place, because we have studied acetyl-CoA is the allosteric activator of pyruvate carboxylase. Please try to remember this point. It is the allosteric activator of pyruvate carboxylase, beta, right? इसमें इसको थोड़ा सा याद रखना है. Allosteric activator of pyruvate carboxylase, important, and that's what is matching with us. This acetyl-CoA is supposed to stimulate gluconeogenesis by activating which enzyme? Pyruvate carboxylase, and that is not getting obtained because in this patient there is a medium chain acyl-CoA dehydrogenase deficiency, which is not able to break down the breast milk's fatty acid to give you acetyl-CoA. breast milk का जो fatty acid वो तोड़ना possible नहीं हो रहा है. That's the reason acetyl-CoA concentration will be decreased. That's why gluconeogenesis also will be decreased. That's why glucose level will not be maintained in this particular child. Yes, in this question the answer is not C, beta, not C. Answer is actually D. अभी इसको सही मार्क करेंगे. I wanted all of you guys to stop making silly mistake. Please try to understand. Read the question. acetyl-CoA gluconeogenesis देख के ये मार्क नहीं करना है. Read दोनों ही. Initial portion is true, but the second one explanation, pyruvate dehydrogenase, no. Acetyl-CoA actually tries to do feedback inhibition to pyruvate dehydrogenase. Acetyl-CoA जब बन जाता है ना, it will try to inhibit the link reaction by inhibiting pyruvate dehydrogenase complex. But at the same time, when he is inhibiting link reaction, he will now stimulate gluconeogenesis. Try to understand the logic over here. In this sort of scenario, whenever acetyl-CoA और एक बार लिखते हैं बेटा इस चीज को. ट्राई टू लर्न समथिंग न्यू एंड इंपॉर्टेंट बेटा. acetyl-CoA over here, try to understand this acetyl-CoA can actually inhibit PDH complex. That means it can stop link reaction, and at the same time acetyl-CoA now it will trigger the pyruvate carboxylase and it will increase the chance of gluconeogenesis. Basically what it will do, it will not allow the pyruvate to get converted to acetyl-CoA further, rather the pyruvate will be getting channelized to oxaloacetate. The sole contributor over here is this acetyl-CoA guy. In our discussion during classes we have discussed about pyruvate carboxylase story. Today I am telling you one extra point. If you can remember this, it is okay, that you should remember better. Acetyl-CoA itself is an feedback inhibition towards PDH complex enzyme. PDH complex enzyme. Yes. 6-year-old in this case. Okay. In this case, sorry, the question should have been 6 month beta. Mistake. Yes, in the question you are exactly right. 6 months old. Yes. क्या बात है. इस क्वेश्चन में हम लोगों ने 2 बार मिस्टेक्स को करेक्ट किया है. क्या बात है. 6 months old boy. प्लीज रिमेंबर. 6 month. 6 year है तो नहीं होगा बेटा. 6 month में होगा. Then breastfeeding we can thought of. However, medium chain acyl-CoA dehydrogenase deficiency can also reflect at a later stage in the life, and that time some other medium chain food that we eat that will be not able to get broken down properly. चलो ठीक है, आगे बढ़ते हैं. 21 लास्ट 5 क्वेश्चन जल्दी से. ये इजी रहेगा. लास्ट 5 क्वेश्चन जल्दी 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 जल्दी. हमको क्या है, हमको पानी निकालने से मतलब है. पानी कैसे ले रहे हैं उससे तो मतलब नहीं है. ओके, आगे बढ़ते हैं. ये कि इसका स्ट्रेट फॉरवर्ड आंसर है बेटा. ये आंसर इजीली करोगे आप लोग. इजीली, इजी 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 इजी. जल्दी से. यस 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 यस, इसमें कोई दिक्कत नहीं है बेटा. ऑल ऑफ यू आर राइट. अनकॉन्जुगेटेड हाइपरबिलिरुबिनेमिया, all liver enzymes are normal. Answer Gilbert. Answer Gilbert. Crigler-Najjar syndrome में please remember it will be UGT deficiency. Please remember people actually gets confused between these two. In Gilbert and in Crigler-Najjar syndrome we have problems with this enzyme that is known as UGT, UDP glucuronyl transferase. Try to understand in the liver. Try to focus over here in the liver. In the liver, basically in the liver, try to focus in this particular concept beta. UCB is actually converted to CV. Name of the enzyme is called as UDP glucuronyl transferase. This is the actual enzyme present in the liver for the conjugation purpose. If this direct enzyme is deficient, then we have problems like Crigler-Najjar syndrome, which has got further 2 types, CNS1 and CNS type 2. यहाँ पर इसके 2 टाइप्स होते हैं, CNS1 and CNS2. It is the problem associated with that main enzyme that is present. But this unconjugated bilirubin, try to understand, heme breakdown से बनते हैं. Remember this heme breakdown, it is actually seen in liver, spleen and bone marrow. Heme जो breakdown होता है ना बेटा, it is seen in liver, spleen and bone marrow. See, if it is broken down in the liver itself, then heme will directly give you UCB and it will be converted to CB. But try to understand, if heme breakdown is done in spleen or in bone marrow, अगर ये 2 अलग अलग जगहों पर होता है और spleen and bone marrow, then what will happen in spleen and bone marrow, it will be broken down till unconjugated bilirubin. Point to be noted, if the heme breakdown is seen inside the liver directly, then it is very easy story, short story. But if heme is broken down in the bone marrow or spleen, then it will also release unconjugated bilirubin in the spleen and bone marrow. But in spleen and bone marrow, we cannot convert this to conjugated bilirubin. That's why we need to send this guy to the liver for conjugation. During that sending, point to be remembered, somewhere over here at the membrane of the liver, somewhere over here in this portion, somebody has to take up this guy and send them towards the liver. We all know UCB is carried by albumin in the plasma. Albumin will carry them from the spleen, albumin will carry them from the bone marrow, and now they have to enter into the liver for conjugation. This uptake has to be done for unconjugated bilirubin. If the unconjugated bilirubin is coming from liver or bone marrow, this uptake is also done by another UGT, which is an isoenzyme of UGT. This is another enzyme which is present in the lining of our liver where UCB uptake is being taken. Important point, try to focus on this better. This is a different enzyme that we are discussing over here, and if this enzyme is actually not working, then we have the disorder that is known as Gilbert syndrome. This is actually a mild variety beta. This is known as Gilbert syndrome. Try to understand this point. This is very, very important. Main enzyme that is inside the liver that is causing conjugation, if that is deficient, it is called as CNS. But if that uptake wala enzyme, that is an isoenzyme of UGT. This is an isoenzyme of the main UGT. If that is deficient, that is called as Gilbert syndrome. Important point, try to focus on this. Thank you so much beta. I hope all of you can gather this knowledge and it will definitely help you in your upcoming exam beta. दो अलग अलग जगहों पर एंजाइम का नाम सेम है, try to understand beta. This is also UGT, this is also UGT, but these are two different types of UGT. One is for conjugation, one is for uptake. Uptake wala if it is gone, Gilbert. If it is the main conjugation gone, that is CNS. That's why main conjugation, if it is problem, then the problem will be more severe than the Gilbert. Gilbert syndrome patients are able to live longer life without any much difficulty. Only thing, they have to be much cautious. Whenever the bilirubin level rises, we have to keep their bilirubin level under control. Gilbert syndrome patients are not that much fatal. Try to understand, right? Important point, इसको एक बार देख लेना बेटा. Coming to question number 22, almost at the few last stretches. Answer to this question बेटा. ये चॉकलेट क्वेश्चन है, चॉकलेट क्वेश्चन है माय डियर फ्रेंड्स. ट्राई टू अंडरस्टैंड दिस क्वेश्चन. Answer, 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 answer. All of you are right. No confusion. In this patient, we can all remember diagnosis is going to be Wilson disease. Diagnosis is going to be Wilson disease beta, and all of us know this is due to ATP7B gene mutation. ATP7B gene mutation, right? ATP7A gene mutation, my dear friends, this is due to Menkes kinky hair syndrome. Menkes kinky hair syndrome. Collagen 1A1 we have just now studied. This is due to osteogenesis imperfecta, OI. Collagen 1A3 is also osteogenesis imperfecta, some other types. In osteogenesis imperfecta beta, we have got 1A1, 1A2, 1A3, 1A4 like that. Out of that, the most common type of mutation in osteogenesis imperfecta is collagen 1A1. However, 1A3 also is a type of osteogenesis imperfecta. 7A is for Menkes kinky hair syndrome. ATP7B is for Wilson disease. What are the take-home points from Wilson disease beta? Please remember, difficulty in speech and writing for the last 4 years, 42 ml. Difficulty in speech, dysarthria can be seen in this patient. Dystonia can be also seen in this patient. Dysarthria, dystonia can be also seen in this patient. Dysarthria, dystonia can be also seen in this patient. Dysarthria, dystonia can be seen in these patients beta. Important point to be noted. And slurring of speech of low volume, gait is limping, slit lamp examination shows KF ring. Answer will go for this. Normal visual acuity usually इस patients में होता है बेटा. LFT shows ALT with decreased serum ceruloplasmin level. Please remember, decreased serum ceruloplasmin level. Coarse hepatic echo texture, liver biopsy shows cirrhotic changes. All these things. Gold standard for the Wilson disease, my dear friends, will be liver biopsy. One more final time for the management purpose. Few of you might be asking some doubts, my dear friends. For the management purpose, sorry, for the diagnosis purpose, there was doubt in many of you. For diagnosis, one more time, I'm writing gold standard is liver biopsy. Liver biopsy is the gold standard. They might also write this word that hepatic content of liver, or they can write it also as liver copper. In liver biopsy, you will be able to see liver copper. Then second, this is the best option. Second one will be increased urinary copper. Third one, my dear friends, will be decrease in the ceruloplasmin level. These three in the order we should try to remember better. Yes, liver biopsy, hepatic liver or the liver copper, urinary copper will be increased. This is for 24 hour urinary output has to be collected for the diagnosis purpose. And please remember that serum ceruloplasmin level will be also decreased over here. Serum ceruloplasmin will be also decreased. Wilson disease को एक बार देख लेना बेटा, those image based questions, KF ring as well as those sunflower type of cataract that we have discussed in our classes, right? Question number 23, almost at the last few stretches. Yes, urine parameter is most commonly used because many doctors in India, they try to avoid liver biopsy in a patients of Wilson disease. They don't want to do so. They just go for urinary copper estimation. Yes, you are right, Peter. Beta ATP7A and ATP7B gene both are producing an enzyme called as copper binding ATPase. Copper binding ATPase presented by ATP7B gene, it will go for excretion of copper. Copper binding ATPase produced by ATP7A gene will go for copper absorption in the intestine, right? Yes, coming to the options. Yes, B D B D B D एक चल रहा है. बाउंसर, yes, बाउंसर, ये तो पड़ा बाउंसर. I knew that everybody will rush towards marking xeroderma pigmentosum, but इस क्वेश्चन का आंसर xeroderma pigmentosum नहीं है. Please try to understand, it is not xeroderma pigmentosum, it is not Lynch syndrome. Answer of this question, my dear friends, yes, no, this is the answer, Bloom syndrome, bouncer. Answer of this question is beta Bloom syndrome, Bloom syndrome. Answer is Bloom syndrome, not xeroderma pigmentosum, not Lynch syndrome. I knew that if I give you this history, that some exposure to sunlight, you guys will be running for the xeroderma pigmentosum. I knew that you guys will make this mistake. That's why I want to teach you that, so that on the real exam you don't make this mistake better. Now please remember, in case of this, try to focus on the positive findings for Bloom syndrome. Positive findings for the Bloom syndrome. In this case, first thing is better, enlarged blood vessels in the eyes. Remember, in case of xeroderma pigmentosum, there is photophobia. This guy is actually presenting with something called as photophobia. But in this case, Bloom syndrome, blood vessel, B for B, blood vessels, B for B, Bloom B, blood vessels are enlarged. Darker red colored patches over the skin on exposure to sunlight. Yes, there is also photosensitivity in these patients. Bloom syndrome, my dear friends, can also present with photosensitivity like that we see in case of xeroderma pigmentosum. Xeroderma pigmentosum also has got photosensitivity. This is a common thing. But in case of Bloom syndrome, there is no photophobia. But no photophobia is seen in the patients of Bloom. Bloom में कोई भी photophobia नहीं होता है, but photophobia can be seen in case of xeroderma pigmentosum. And on top of that, look at the other positive findings: long narrow face, small lower jaw, prominent ears and prominent nose, and high pitched voice. High pitched voice. These are the classical appearances of patients of Bloom syndrome beta, and it is due to a defective DNA repair. Let us try to focus on this question beta. DNA repair defects are big list. DNA repair defects are actually big list over here. DNA repair defect, total 6 types are there. Out of 5 types there we have got some disorders. एक बार इसको देख लेते हैं बेटा. Due to shortage of time, we did not discuss this in our regular classes. Try to remember and learn it from over here now. There are total 6 types of DNA repair mechanisms. Out of that, please remember number 2, nucleotide excision repair if it is defective. Then there are 2 disorders over here beta. Either the answer will be xeroderma pigmentosum, or the answer can be also trichothiodystrophy. NER, most common type. This is the most common type of DNA repair. Most common type of DNA repair that we have beta in the human body. It is a type of nucleotide excision repair, and its defect, अगर इसका defect हुआ, we have a condition called as xeroderma pigmentosum, right? Apart from that, we also have trichothiodystrophy. Remember, second one, we have got some strand directed mismatch repair. People call it as MMR, mismatch repair. And if we have a defect of that, then we have something called as Lynch syndrome. Other name is called as HNPCC. HNPCC stands for hereditary non-polyposis colonic cancer. Hereditary non-polyposis colon cancer or colorectal cancer. This is called as HNPCC. This is due to MMR defect. Please remember this. MMR defect. Base excision repair. If this is defective, base excision repair, if it is defective, we have something called as MAP. Muti associated polyposis. Please remember, we have something called as DSBs. There is something called as DSBs, double strand break repairs. These DSBs, my dear friends, are of two types. These DSB repairs further are of two types. One is called as HR, another one is called as NHEJ. HR is not human resources. This is homologous recombination. And NHEJ is non-homologous but end joining. These are the topics of molecular biology and their related disorder. We did not discuss this in our classes regularly, but try to understand if some points extra can you gather. HR, homologous recombination, and NHEG both are type of double stranded DNA break repairs. अगर किसी डबल स्ट्रैंड में कहीं पर ब्रेक होता है, उसको रिपेयर करने के लिए हमारे पास दो उपाय है. Either we call it as a homologous recombination or we call it as a non-homologous end joining. And in case of homologous recombination, if this is defective, then we have our disorder that is called as Bloom syndrome. Okay. Bloom syndrome is a defect due to DSBs of which type? HR type. DSBs of HR type, it is Bloom syndrome. Apart from that, we also have something called as Werner syndrome. And we also have something called Rothmund-Thompson syndrome. Rothmund-Thompson कहाँ गया? यहाँ पर है ना, Rothmund-Thompson syndrome. And we also have something called as BRCA1, BRCA2, and also Neuro-Behcet's disease or Neuro-Behcet syndrome, NBS. Big list is there. At least remember Bloom and Werner for homologous recombination. Remember, NHEJ defect, there is extreme sensitivity to ionizing radiation, loss of lymphocytes, and we also have one disorder called as ATM. Please remember, what is ATM over here? This is ataxia telangiectasia, and this is due to ATM gene mutation. What is ATM gene, beta? ATM gene stands for ataxia telangiectasia mutated gene. ATM. Please remember, ATM gene, ataxia telangiectasia mutated gene. जीन का नाम ही है म्यूटेटेड जीन, that can lead to a condition called as ataxia telangiectasia, and this is due to NHEJ. Even Fanconi's anemia is due to NHEJ. At least remember these two better. HR, Bloom syndrome, Werner syndrome, NHEJ defect, ataxia telangiectasia, and Fanconi anemia. And if it is a defect of transcription coupled NER, nucleotide excision repair, if it is getting linked or coupled with transcription, after replication, process has gone into transcription. During the transcription, you are trying to relate and you are trying to correct the mistakes in some DNA. Transcription start ho gaya hai. Transcription has already been started. DNA is trying to get changed into mRNA. But during that late time, you have understood that, oh, some mistakes were there. We have to now correct that mistake. डीएनए रेप्लिकेशन होने के बाद जब वो ट्रांसक्रिप्शन में पहुंच गया है, ड्यूरिंग ट्रांसक्रिप्शन इफ यू ट्राई टू करेक्ट ए डीएनए रिपेयर, try to understand, this is called as transcription coupled NER, and this defect leads to something called as Cockayne syndrome. Some books write Cockayne syndrome is due to nucleotide excision repair defect. No, nucleotide excision repair defect, the answer you will mark xeroderma pigmentosum or trichothiodystrophy. But if it is a case of transcription coupled NER, then the defect is called as Cockayne syndrome. If transcription coupled word is not given, if the first two words are not given, then you can choose the answer as NER. But if this option is present, if this option is given transcription coupled NER, then you should choose this one as the better answer. Take home point: nucleotide excision repair defect, XP, trichothiodystrophy. Mismatch repair, HNPCC, Lynch syndrome. Base excretion repair, MAP. Double strand break repair, HR type of repair, Bloom and Werner. NHEJ, ataxia telangiectasia, and Fanconi's anemia. Cockayne syndrome is nucleotide excision repair, but that is coupled to transcription. Try to understand this point. These are the important that we have to याद करना है. थोड़ा सा एक्स्ट्रा मैं बोल रहा हूं बेटा, अगर थोड़ा सा ये याद रह गया तो एक और क्वेश्चंस को हम लोग सही करके आएंगे. इसमें से एक क्वेश्चन आता है यूजुअली डीएनए रिपेयर डिफेक्ट्स में से, एक बार इसको देख लेना. इट इज एक्चुअली डिस्कस्ड मोर इन डिटेल इन पीजी लेवल एग्जाम, बट यहां पर थोड़ा थोड़ा नाम को एक बार देख लेना 2-3 बाउंस. ट्राई टू अंडरस्टैंड दिस पेज. आई हैव केप्ट इट एज ए रिमेंबर पेज बेटा. रिमेंबर, in case of Bloom syndrome, in the Bloom syndrome they also presents with something called as phototoxicity, है ना, phototoxicity, not photocarcinogenicity. Okay, xeroderma pigmentosum, whenever the sunlight is falling on the skin exposed area, those areas can predispose to skin cancer. Xeroderma pigmentosum is a precancerous type of situation, but Bloom syndrome is not that so, where there will be skin cancer. Some other cancers can be possible in Bloom syndrome. Bloom syndrome, we have got some other types of cancer. Lymphoma, leukemia, GIT cancers are common, but there is no skin cancer. Skin cancer on falling sunlight, then the diagnosis will be going for Xeroderma pigmentosum, where we have blistering sunburns, dry thin skin, xerosis. There can be also freckling. Freckling means cracks, which are also called as lentigos. Before the age of 2, 2 साल के भीतर ये चीज आता है. Before the age of 2, before the age of 2 is an important, before the age of 2. And patches of increased and decreased skin coloration, which is also called as poikiloderma. Poikiloderma, my dear friends, can be also seen in the case of Bloom syndrome as well. Either some zones will be darker, some zones would be more lighter. Lighter, darker, these patches are called as poikiloderma. And there is also chance of photophobia. Yes, photophobia is seen in case of Xeroderma pigmentosum. I am trying to focus on those two disorders from where question has been asked in our FMG exam. Photophobia is also quite seen in case of Xeroderma pigmentosum. There is also eye surface cancers, yes, surface, as well as skin cancer and skin aging. This sort of things are common with XP, Xeroderma pigmentosum. However, in case of Bloom, please remember, these are small clusters of enlarged blood vessel may be seen in the eyes. Small cluster repair blood vessel may appear in the rash or in the small cluster enlarged blood vessel, B for B, B for B. And other symptoms, please remember, there might be also chance of poikiloderma as discussed with you. Small jaw, large ear, high pitched voice, fertility problem, learning problem, so on. The list goes on like this. And please remember, increased risk of developing cancer at an early age, but not skin cancer. Not skin cancer. Lymphoma, leukemia, GIT cancer, but not skin cancer. Not skin cancer. Skin cancer history, if they had mentioned, please choose the answer as Xeroderma pigmentosum. But they have not mentioned photophobia. They have mentioned these enlarged blood vessels and these features. Try to go for Bloom syndrome. Try to go for Bloom syndrome. These are the points that we need to remember better. Important. Yes, Mr. India बन जाता हूँ. Okay, एक photo. Yes, definitely बेटा. Please feel free. First take a photo of this. Another you take a photo of that. I will show you that. आराम से, no problem. I am here to help you बेटा. We will pass. थोड़ा सा extra push कर रहा हूँ. I know. I am pushing you a little hard over here. बट वी हैव टू रिमेंबर दिस 2 पॉइंट्स. थोड़ा सा इसको देख लेना है बेटा. ये सब टॉपिक एक्चुअली पीजी लेवल एग्जाम में ज्यादा पढ़ाया जाता है, बट एफएमजी लेवल में भी आजकल क्वेश्चन पूछ रहा है, तो क्या करें, थोड़ा सा इसको देख के जाना है बेटा. इसको थोड़ा सा देख लो, इसको एक बार क्लिक कर लो और इसको भी एक बार फोटो ले लो. चलो कोई बात नहीं, नो इश्यूज बेटा, फील फ्री. एक बार इसको देख लो, ठीक है ना. ओके, इसको देख लेना बेटा. होप दिस इज क्रिस्टल क्लियर टू ऑल ऑफ यू. स्क्रीनशॉट ले लीजिए, याद रखने का कोशिश कीजिए, ठीक है. कोशिश करेंगे तो जरूर हो सकता है, ठीक है. ओके बेटा, आगे बढ़ते हैं. ट्राइंग टू द कम टू द लास्ट 2 क्वेश्चंस. वी हैव बीन स्ट्रेचिंग दिस सेशन फॉर आवर इजी अंडरस्टैंडिंग. थोड़ा सा एक बार देख लेना, ठीक है बेटा. इसको एक बार देख लीजिएगा, नो इश्यूज एट ऑल. 24 आंसर आंसर आंसर. 2 क्वेश्चन है, इजी है, जल्दी खत्म करते हैं. आप भी ठीक करते हैं, घर जाते हैं, रिवाइज करेंगे। ओके, जल्दी से लास्ट 2 क्वेश्चंस देख लो। लास्ट 2 क्वेश्चंस। ये तो आंसर इजी है। हेलो, ये तो इजी 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 इजी। ऑल ऑफ यू आर राइट। डायग्नोसिस क्या है इसका? दिस इज द केस ऑफ आर्जेंटाफिनोमा। दिस इज द केस ऑफ व्हाट बेटा जी? Argentaffinoma. This is the case of Argentaffinoma. All of us try to remember this. This is a case of what? Argentaffinoma. We have studied this beta. And in this case, actually, this Argentaffinoma has gone on causing something called as MCS, that is malignant carcinoid syndrome. Malignant carcinoid syndrome. Malignant carcinoid syndrome. है ना बेटा? Because please remember, this is actually after the meals confined to lower abdomen, because we know most common site is over there, ileum. In this case, it is the mid jejunum. Exploratory laparotomy and mesenteric biopsy revealed to be a case of Argentaffinoma. Small bowel was removed where there was a block, because this sort of things will also try to cause a little bit of intermittent diarrhea as well. So small bowel resection was done, and urinary marker likely to be monitoring. Yes, for monitoring we all know it is 5-HIAA, right? This parameter we have written over there earlier today in our discussion as well. This is 5-HIAA. HIAA. Malignant carcinoid syndrome, Argentaffinoma, we know the mnemonic. This is ERA. Most common site, my dear friends, most common site as per Harrison. Most common site as per Harrison, you will try to relate to ileum, followed by rectum, followed by appendix. This is as per the Harrison that we will try to remember बेटा. इलियम में भी कहां पर सबसे ज्यादा कॉमन होता है? टर्मिनल इलियम. टर्मिनल ileum, my dear friends, is going to be the most common site. Terminal ileum, right? IRA. And the diagnostic parameter is 5-HIAA. We also have some got other markers for this malignant carcinoid syndrome. You may remember something called as synaptophysin and something called as neuron specific enolase. Neuron specific enolase. These are some other markers, but 5-HIAA is the gold standard marker that we have to follow on this, right? Synaptophysin and neuron specific enolase, right? इसको एक बार देख लीजिएगा बेटा. फिग्लू किस में आता है? फिग्लू we all know in case of B9 deficiency. All of you are right. And 3,4-DHPA and 5,3-hydroxyanthonic acid, these are not important for our exam, right? इसको थोड़ा सा देख लेना. B9 deficiency में this is an old test people used to do, Figlu excretion test for B9 deficiencies. क्रोमोग्रानिन वगैरह हम लोग कर सकते हैं कार्सिनोइड में. न्यूरॉन स्पेसिफिक एनोलेस, NSSA, yes, न्यूरॉन स्पेसिफिक एनोलेस A, we can also go for diagnosis by this. Coming to the last and final question of our discussion, beta ji. After that, we will meet some other day somewhere. World is small, our paths will definitely cross each other sometime. हिस्टोन नहीं बेटा, हिस्टिडीन लोडिंग टेस्ट. नरेश उसको थोड़ा सा करेक्ट कर लेंगे. हिस्टिडीन लोडिंग टेस्ट, यस, हिस्टिडीन लोडिंग टेस्ट. हर्ष, यस. लास्ट क्वेश्चन, चॉकलेट क्वेश्चन. Yes, 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 yes. All of you are right. We are beginning on a positive note so that all of you can stay motivated and all of you can come up with the right answers when it will matter the most. इसमें आंसर एक ही होगा बेटा, मैपल सिरप यूरिन डिजीज, MSUD. This is due to deficiency of which one? BCKD. Yes, this is deficiency of which one? BCKD. BCKD complex. What is this BCKD complex? Branched chain alpha keto acid dehydrogenase complex. How did you come to this diagnosis? Because of this word, burnt sugar smell in urine. Burnt sugar smell. Burnt sugar smell in urine, my dear friends. Acidosis, hypoglycemia, all these things are common. ABG analysis में acidosis होगा. Urinary ketones also will become positive because in this case branch chain ketones are coming out in the urine. It is also called as branched chain ketonuria, है ना? हम लोगों ने पढ़ा था बेटा इस चीज को, है ना? Branched chain ketonuria. And this branched chain ketones which are coming out positive, they are the one that will be able to be detected by dipstick test. However, this branch in ketonuria can be also diagnosed by one more test that was called as DNPH test, dinitrophenyl hydrazine test. DNPH टेस्ट भी हम लोग कर सकते हैं इसको इसको एक बार देख लेना बेटा. रिमेंबर इन दिस क्वेश्चन देयर इज नो मेंशन ऑफ हाइपर एमोनेमिया. हाइपर एमोनेमिया अगर होता देन यू कुड हैव गॉन फॉर यूरिया साइकिल एंजाइम डिफेक्ट. हाइपर एमोनेमिया में in this case usually they will give you the options as hyperammonemia. Hyperammonemia यहाँ पर मेंशन नहीं है बेटा जी. Important point. That's why the answer will be going for this. Multiple carboxylase deficiency is a PG level topic. Propionic acidemia, just remember it is the disorder of propionate metabolism, right? So thank you so much my dear friends for coming online live, and we got to learn many things from each other. We learned how to avoid silly mistakes. We also learned some new information and try to soak into this image. And sincerely thank you once again for coming online and attending this session live beta. My best wishes are always with you all, from the core of my heart, from the bottom of my essay node. My dear friends, I am praying for each and every one of you that all of you can come with the flying colors on the exam day beta. Doesn't mean what has happened in the past, no matter that you are an FMG right now, but soon my dear friends, all of we are going to become an IMG. Proudly we can say that I am equal to an Indian medical graduate as well. There is only one checkpoint ahead of you beta. We are going to break that barrier. We are going to go through that checkpoint and we will transform from an FMG to an IMG. It is just one step ahead. Please put your middle in the pedal my dear friends, and definitely you are all going to pass in the upcoming exam on 12th of Jan. Praying to God, and definitely your parents, your blessings, entire team of mist wholeheartedly is praying for each and every one of you, and we will do the miracle beta on that day. हम लोग करेंगे, करके ही आएंगे, करना ही पड़ेगा, और कोई उपाय है ही नहीं. Thank you so much once again for coming on live, and wish you guys all the very 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 best, and we all will pass. Every one of you will pass. Thank you so much beta. Thank you so much. Thank you so much, and see you some other time. एग्जाम के बाद बात करते हैं, रिकॉल सेशन के टाइम में बात करेंगे, देखते हैं कितना क्वेश्चन आया हुआ.